Good morning, good evening, good afternoon, wherever you are, whoever you are, whatever you are. And Jamie, do you know Yellow Cottage Tail?
I've heard of him. I don't think I've ever watched him though.
He was on Court TV yesterday to talk about
Um,
why he believes she's guilty.
why? No, he wasn't.
Yes, he was. Good old Kevin.
No, I know
He
he's
was
like kind of a
he was the
lunatic.
guy
So
who inspired this little piece of AI art I made.
yeah,
Let's see
I mean,
how
I've heard
he.
his theories, and they're stupid.
No, let's watch this.
Animation. We're gonna roll that right now, and just describe what it's based upon, how you came to.
Yeah, so
this.
I'm sorry. Yeah, I struggled all summer trying to make sense, like all of us here, of the injuries combined, what we know about the injuries combined with the damage to the vehicle, right? So John is found 6 to 12 feet on the lawn. Next to him in with the grass where there's no snow has accumulated, there are cocktail pieces. And we're told that the only injuries below his neck were possibly traumatic injury to the pancreas. We do also know he was knocked out of a shoe. And yet there was also damage to the car. There was DNA and a hair found on the car, and the tail light is cracked. So I really struggled to try to understand how a vehicle could make that head wound and not damage his torso.
And
so
not damage his torso. So
this
yeah,
is, this is an attempt at that.
right.
This is
Like,
just an
yeah,
attempt.
he left the drink in the street, which
Yeah.
I get it. All right. I want to thank
So
Rusty
stupid.
Hay Animation.
I don't know if Winnie was pulling his leg or whatever he was
Yes,
doing,
he
but
was.
this was, first of all, when you do AI art, you can fix it so it's the right side that you try to put in as the side that hit him. Second of all, that head wound is by Lely's statement, not caused by the vehicle.
No.
So
So his rendition is not even what they are stating happened.
no,
Also, going that fast in reverse and hitting him right where that stupid little video shows, I feel like it would have just like knocked his head clean off. If it was just like that, like, or
it would
took
have
some of
broken
it
his
off.
neck.
Yeah.
It'll have broken his neck if he was hit at
He
34.2
just left a
miles per
glass
hour.
in the road and went and picked it up. Oh no, no big deal. Let me go grab this glass. Oh man.
Except he totally misstated the evidence. Hey, Nima, missed you so much. Even Kevin must know his little reenactment is not anywhere near what Lally claims happened. And
Exactly.
second of all, that car wasn't the right car. It wasn't the right side. And he didn't
Nope.
land 6 to 12 feet away from the road. The
Nope.
cocktail glass wasn't beside him, it was beneath him.
Mm-hmm.
So, other than that, yeah, Kevin is great. Except everything
Yeah.
factual, everything is wrong. But other than that,
He knows exactly what he's talking about.
hey, Sophia Stalin, member for 2 months. Thank you so much.
Hey, Sophia.
The other shoe was found at 6 p.m. because you go around, you wouldn't see a size 12 shoe, and you wouldn't see any of the red glass. You will only see clear glass.
Yep.
Don't think about it, just accept it. Because if you start thinking about it, you might end up with the same haircut as Lally. Even your dog Kevin is offended by that. Hey, on
Yes.
Bronze Aussie. And Patty. Oh, Jamie, what do we expect today?
I hope some good witnesses and less talk about snow and life experiences for all of these people.
How about how you do first class CPR? That's the gold standard. You know that's the gold standard, Jamie.
First class. Oh, I didn't. Yeah. No.
We're gonna have that Pee Wee Herman guy with the goatee up there He talked for 20 minutes Tuesday. Didn't go anywhere. And
Hopefully we're done with his credentials now, but who knows?
well, do we know
Watch him
how
go,
many?
could you please restate everything he said?
Yeah,
on
just so that
Tuesday?
you
God.
remembers how many cars are in the garage at each fire station in Canton.
Yes, please.
Oh, Chadwick, don't tell people from Massachusetts. They will stress pee like I do when I see a snake. Never mind the shoe. Where's the tail light? Well, they were in that snowbank, you know. That snowbank, because you can't see red plastic in a snowbank. Peter A., stop confusing people. It's
Stop
clear.
focusing on the wrong things, Peter.
Just look at my board. You wouldn't be able to see those red on white post-its up there. It's totally impossible to see that. You have to wait till I turn off the light. Then they become clear. Well, thank you so much. I love fooling around with AI sometimes. Heading offshore. Well, have fun. Hope you're going fishing or something. Yeah. When was the last time you washed the fire engine that you didn't take to the scene? If the broken cocktail glass was where John was lying, wouldn't Karen, Kerry, and the first responders performing CPR be kneeling in broken glass shards? It was underneath his body. Because as you just saw in Plevin's very, very good AI video, it just fell over next to him. Because you don't have to think about physics, because it was snowing that day. If he was standing like that fool tried to imply, the glass would be flung down the road, not behind him. So it doesn't make sense. Don't try to make it make sense, because then you'll just sit here and get an ulcer. Where's the grass that was supposedly under him? We could see that's a downtrodden snow. Yeah, the problem is we have seen way too many jurors who don't do that. Yeah, Lefty, I know you love the state, but always the presumption of innocence. Remember that. Does it? Well, according to Lally, snow is it's as rare in Massachusetts as it is in the southern Florida. Peter, does it ever snow near where you live? No, glass shards from the cocktail glass under his body. The glass that tore up his arm, as Lally stated in the opening statements. That blunt force lacerations to his arm was from the glass that he must have kept up his sleeve. How else would it stay on his arm and tore it up? Yeah, because again, the car is moving at 24.2 miles per hour, so it wouldn't flip him to the side. No, he just falls back. Don't think about it. He got that shown on court TV yesterday.
Yeah, it wouldn't just like break his neck or anything.
No, absolutely not. Yeah, Grant has all the grass.
And if it hit him so hard on the side of the head like that,
well, bust his side of his head.
Massive.
It would bust his skull on the front, but that's not where his skull is busted.
Exactly.
It's busted in the back.
So then he turned his head, like cocked his head all weird. Yeah, that's what happened. These people, I swear.
Yeah, he was kind of leaning with his head, and Lally stated he was never hit in the head. Hey, Julie, how's Scotland today? It only snows in July in your freezer. Yeah, apparently that's what happens at Lally's house. Well, no, nothing was convenient in place. His phone was under his body. No one really knows how it got in the hands of Proctor, but it got there. So
I told my sister to watch this. She doesn't watch trials at all. And I said, hey, you should really check this out. And now she's like hooked. She like texted me this morning. She's like, what time does it start today? I was like 9.
I told her that she should go check out one of the great streamers or Court TV or something.
I
instead
don't
of
know where she
watching us.
watches it. I gave her all the links, but
Mm.
she can't believe what's going on. She's just somebody who doesn't know, anything. She's like, this is crazy. It's like a movie.
Yeah. And anyone who sees anything in this case and still believes that Lally has a good case, well, again, I still give him a 55% chance of getting a guilty verdict, but still. Jeepers, the first 2 days, we have had 6 witnesses. All of them could have been brought by the defense because, oh my God, they were bad.
You would have loved it. The first words out of her mouth when she called me yesterday to talk about it. She was like, "Why do they keep talking about the snow so much?" I was like, she's like, "Get over it. It wasn't even that bad."
No, but remember, Massachusetts don't do snow because they live so far south that it rarely snows down there.
And she's a nurse too, so like she was listening to some of the stuff that they're talking about. She was like, that doesn't sound right at all. And she's super appalled by the fact that the dude didn't even come out of his house. She's like, you can't tell me that you didn't see all those people out there, hear that yelling, or see all those lights and didn't wake up.
Yeah. Yeah, but sadly, most jurors will say, well, they showed us so many witnesses, they must have said something. So that's sadly how it goes most cases. 3+ hours on non-court day. Well, as I said this morning, because everyone was going on about, when I reach 7,000 subscribers, I do a 7-hour stream. I said, if I reach 4,000 subscribers, I will keep my streams at 4 hours. Because my problem isn't going 7 hours.
Giggity, giggity, giggity.
That's more, I don't stop enough. Started talking to your sister about this a year ago. Now she's saying something's really wrong with the police. I've been filling her in daily now. Yeah, it's a weird case. And it never starts on time. But again, let's just go over day one. The brother, the sister-in-law. We liked her. They had normal problems. She came to the house and got her things. She was calling me on the day where it happened because he had yelled at her. That was in totality what they did for 4 hours. And there might have been something on a Aruba trip with some other lady. That was everything we got out of those 2 witnesses. Then you had the first responding officer who gave us the knowledge that the call sheet was wrong, the address was wrong, the order of police was wrong. He changed his statement 3 times. Never checked anything at the crime scene. Never saw any tail lights. Didn't notice that Jen McCabe walked up to the house. We know that Karen Reed was very hysterical and was trying to do CPR. We know Jen McCabe was just standing on the road doing nothing. Second officer, same story. He just didn't notice Karen had blood in her face. Then we had Boy Wonder with his first-class CPR, who imagined him wearing a big, thick, down-filled jacket until he was shown pictures, and it was a nylon sweatshirt.
Yep.
But he clearly heard her because he asked her. He looked up at her and said, "What happened?" And she looked at him and said, "I killed him. I killed him. I killed him." He clearly heard that.
She said, "I hit him." Yeah.
I hit him. I hit him. I hit him. Sorry. Yeah, it's because I read someone else today said, "Well, he clearly stated I killed him." No.
Yeah.
I hit him. I hit him. I hit him. He never reported that to anyone before the grand jury. He never told the hospital, "You might have to check him because she hit him with a car." She just stated that at the scene. Never ever told it to anyone until he had a talk with the proctor, and then he remembered it at the grand jury. And now we're going to have Pee Wee Herman with a goatee, who is probably going to say something along the same lines, that while they were administering CPR, and we have seen her state of mind, because we have seen the video of her running around like a headless chicken. But apparently she walks up and looks at him while asked and says, I hit him, I hit him, I hit him.
Yep.
The police officers never heard that. The police officers who was there before the EMTs, who said we couldn't get anything out of that woman. The only thing she was screaming, it's my boyfriend.
And then changed to
Is he dead?
it's my fault, or I did it, or something like that. Whatever that one guy said, I forgot.
Yeah, but that he didn't have anything. He changed that story.
Yeah, that was his final story of she was saying, I did it, or whatever.
What? Have you told your sister to watch the first Rocky Balboa movie? There's a lot of nutrients in eggs. Hey, Ruby. The police are clones. Well, they're clowns at least. The fact that Karen Reed has been out on bail says a lot. The court rarely grants bail for someone charged with unaliving. Yeah, and an $80,000 one, that's a low one, but still, that's one thing.
Usually it's in the millions.
But why would they let this come to a trial? That's the part I don't get. I know why,
They
because
must have some damning evidence that's going to come out. I can't wait.
well, yeah, maybe. Hey, KDP and
No,
Vinus
I
and Gordon.
don't think so at all.
Zero sum sameness. Worse than that, he didn't tell police at the scene to determine what she used to hit him. Yeah, wouldn't you just say, "Hey, officers, she just said she hit him. You might want to detain her." Nothing. Nothing.
Yeah.
Nothing.
We talked about that too, because she said she worked in the emergency room for a while, and she's like, we have to be relayed information of like what we're dealing with when patients come in. So it's crazy that he didn't even tell anyone.
Yeah,
So
I'm always in a good mood until Jamie starts yelling. She's so disconnected, didn't know anything was happening with it. But you want to talk drama? She's your gal. Yeah. Well, I once had a sister-in-law who said, I don't see the news because then nothing bad happens in the world. I said, that's not how it works. Yes, because I don't know about it. That's something you say to kids when you're young, when you say, I can't see you. It's not, the kid hasn't magically disappeared. It's just you who closes your eyes. It's not like the world stops turning because. Hey. Didn't he say they took off a heavy coat of him? Yeah. He notices his hands were so stiff because they had a hard time pulling off his jacket. So, and then he was asked 5 times by Alan Jackson about that heavy coat, and he clearly remembered it. And then he showed him the real pictures. Oh, Valhalla will be here in a short while. Just as court's about to start. Just take her off until they. Nope, she yells at me too.
whatever.
Oh yeah, that's now is a great time to be outside.
Hear ye, hear ye, hear ye. All
I
parties
hate
have been
hearing
made due before the honorable first.
Come on.
Now sitting in the ghetto, here in court within the court of county of Norfolk. Draw near, give your attendance, you shall be heard. God save the Commonwealth and this with the court. Thank you.
Your Honor, this is 22-82-117, the Commonwealth versus Karen Reed. Can I have counsel identify themselves for the record, starting with the Commonwealth?
Adam Riley to the Commonwealth. Good morning, Your Honor.
Good morning, Mr. Lally.
Good morning, Your Honor. Laura McLaughlin for the Commonwealth.
Good morning, Ms. McLaughlin.
Alan Jackson on behalf of Ms. Reed. Good morning, Your Honor.
Good morning, Mr. Jackson.
Elizabeth Little also on behalf of Ms. Reed.
Good morning, Ms. Little.
Good morning, Judge David Yannetti for Karen Reed.
Good morning, Mr. Yannetti. Good morning, Ms. Reed. Good morning, jurors.
So I have to ask you those same 3 questions. Were you all able to follow the instructions and refrain from discussing this case with anyone? Everyone said yes or nodded affirmatively. Were you also able to follow the instructions and refrain from doing any independent research or investigation into this case?
Yes.
Everyone said yes or nodded affirmatively. Did anyone happen to see, hear, or read anything about this case since we left here on Tuesday? No. Everyone said no or shook their heads.
Yeah, he's going to sigh in a second.
Jurors, from time to time, I will give you instructions or talk to you for a few minutes about how you evaluate evidence. So I just want to take a couple of minutes today. It's part of my job, where my job is to teach the jury about the law. So in considering the testimony of any witness, please remember that questions are not evidence. Only the answers, which are in fact the only part of the exchange between the lawyer and the witness that are given under oath, are evidence. So if a witness is asked, isn't it true that after you learned that your uncle left you money in his will, you poisoned him? And the witness answers no, based solely on that question.
Someone knows it went really, really bad the first 2 days.
Yeah. Look at her trying to fix everything for the state. She's so stupid.
It's let's clean up because Alan Jackson got some questions in and they objected too late.
And that answer, there's no evidence that the witness has an uncle, that the uncle had a will, that the uncle left the witness money, that the witness knew that he did, or that the witness poisoned him. So going forward, I want you to consider the evidence in that regard.
Anyone press 1 in
Also,
the chat
there were
if you understand
videos
what
shown
said.
to you, and I expect that throughout the course of this trial, there'll be many more videos shown to you. These videos are evidence, and there's audio on these. So what the video shows is for you folks to decide, not me, not any of the lawyers.
Oh, now we have to clean up that part about Jen McCabe going to the house. Why the F is she allowed to do this?
Because she knows it's bad
What
for
an
them.
audio recording says is for you to decide, not me, not any of the lawyers, because you find the facts. That's your job. We all
Well,
have different
case
jobs,
didn't go so bad.
but finding the facts in the case is your job. Okay, so with that, please get your Commonwealth's witness back on the stand, Mr. Flamati.
Jesus. This is so corrupt. I'm sorry. Where's Daddy? Daddy O'Keefe.
Jim, swear it again, please. Thank you.
Normally, if there's something, they will read a short statement. They will never go back and tell you how you should evaluate evidence. This is because Auntie Bev went home and little Lally called her and said, Auntie, it's going so badly. And they found stuff on the video I didn't see.
Please watch a step forward. I just need you to raise your right hand one more time. Do you solemnly swear the evidence you give the court and jury the case now and here, to the truth, the whole truth, and nothing but the truth, so help you God?
All right, Mr. Lally, whenever you're ready.
Before I begin, may I just approach the witness to return exhibit 1?
Sure.
Morning, sir. Good morning. Now, firefighter Flamati. I believe when we had left off the other day, you had arrived in the area of 34 Fairview Road, is that correct? Correct. And when you arrived there, what, if anything, did you do upon your arrival?
So on arrival, positioning the apparatus is going to be our most important thing, trying to figure out where our patient is and parking our apparatus close enough, especially at nighttime, that we can light up the scene as well as we can. Try and figure out how to approach a scene, because if we have to trek equipment farther distances, it can slow our response down. So we try and make sure our arrival and positioning is as best as we can put it.
And as far as positioning in reference to when you first are sort of pulling up on the scene, where are you in the ambulance again?
So I would have been the passenger of the ambulance. Usually the tech that's leading into the call will sit on the passenger side to try and mentally get ready for what's going on, whether it's reviewing protocols or just trying to assess the information coming across the radio so you can update your treatment plan as much as you can before you even see the victim.
And when the ambulance comes to a stop or it's parked in your positions, where is, what if anything do you see sort of as far as the scene is concerned?
So we have our fire apparatus that are helping light up the scene, but we also have 2 female parties going by to the victim on the side of the road, and going back and forth between that person and the side of the road.
And from the position when you first arrive, are you able to see the person on the side of the road?
You can see a shape of a person, so we know that's where the patient is, because we were reported that there was a party on the side of the road. So seeing a body shape, that clued us that that was where we were headed.
In addition to the ambulance that you're in, how many other vehicles are on scene when you get there?
When I get there, I believe it is engine 3 and car 5.
And beyond sort of the vehicles from your department, what if any other vehicles do you see when you get there?
If I remember correctly, it was just a personal vehicle. I don't remember if there's any police cars on scene at that time.
And from
You
your
can see the 3
orientation, when
police
you
cars.
pull up, where is the body positioned? To your left, to your right, or something?
To my left.
And so after the ambulance is positioned, what do you do?
So then it's going to be bringing all the equipment over to the patient's side to be able to extricate them from that situation, whether it's a house or a street or a road. We assess where they are, and then the best tools to get them out into the ambulance to be able to work effectively on the
Hey,
patient.
CC Raiders, we're just getting
When you
started.
proceed over to, now, again, at some point subsequent later on, are you able to identify who the person on the ground is?
Yes, we will try and get a general idea of the age of the patient, the positioning of the patient, how they were found, and then when we get them into the ambulance, we can start identifying ways to register that patient in the emergency room. So identifiers, whether it's a license or witnesses, or we try and figure out who they are so they can get registered at the hospital.
At some point, were you able to identify who this person was?
That's correct. His wallet was in his pocket and we were able to grab his license.
And who were you able to identify?
That was John O'Keefe.
And so, with reference to Mr. O'Keefe, when you first observed him on the ground, how far away from the street or the roadway is that?
I'd say approximately 10 feet away from the road.
And how is he positioned as far as how is his body positioned on?
Yeah, that's the same.
But I believe he was supine on his back.
Just in general terms, first, when you're responding to a call of this nature, what are some of the protocols or that you were speaking about? What is it that you're seeking to do or assess when you first arrive?
So we're trying to determine if it's a cardiac arrest, that whether it's a viable transport or workable arrest. We have certain protocols within the Massachusetts protocols for whether we work the patient or we relieve the patient on scene if it's a police matter, if there's injuries not sustainable with life. So we're trying to make that assessment before we make any decisions.
Let me stop you there just for 1 second. You do use a term as far as cardiac arrest. Based on your training and experience, what do you want to say in that term?
So cardiac arrest, to the best of my knowledge, is just the cessation of electrical and mechanical activity in the cardiac muscle. So the cardiac muscle pumps blood throughout the body, and when that stops.
Why are we going over what a heart
What a
attack
cardiac
is?
arrest is?
We're talking about a guy who unalived on hypothermia, and now we're talking about what's the definition of a cardiac arrest?
Because he has nothing. He's so pathetic.
Everyone coming in from Chelsea, good morning. Karen Reed, day 3. Started out with the judge all of a sudden instructing the juries that they shouldn't believe they shouldn't listen to the questions the lawyer asks, only to the responses. And when they watch videos, they should determine themselves, not listen to what the lawyer says. Because the first 2 days, Alan Jackson has been tearing the state a new one. And we had a video showing someone walking up to the house, even though no one have ever testified they went to the house. So this judge probably had a talk with the, well, I can't claim that because I don't know it. I absolutely don't think she had a talk with the ADA who was crying and said, it's going so bad, please help me. And now we've been going for 15 minutes talking about absolutely nothing that has anything to do with the case other than we had light at the scene. Jamie, what lights up in light?
What? Oh, lights?
No, reflective glass.
Mm-hmm.
But no one saw 45 pieces of tail light in the heavy floodlights. And no one from the house got woken up by the heavy floodlights they use.
No, and the screaming and the sounds, nothing.
Yeah.
Now, in particular reference to the conditions, the weather conditions that you find yourself in, what, if anything else, is sort of on the scale or spectrum in regard to diagnosis?
So cardiac arrest, depending on where they're found, we try and figure out what led them to be at that point. So we're looking at weather conditions as well. That can also affect viability of resuscitation. So due to the extreme weather, extreme cold, we'll attempt resuscitation on that patient due to the fact that it'll prolong viability of the arrest or ability to recover from cardiac arrest afterwards. So weather is definitely a key factor in where they are found.
And you're familiar with the term based on your training experience called hypothermia?
Correct.
And so what, if any, sort of relationship does cardiac arrest have? Well, let me ask you this first. What is your understanding of the term hypothermia?
Exposure to extreme cold that lowers your core and extremity temperatures down to a below 95 degrees, usually.
And what, if any, interplay is there between hypothermia and cardiac arrest?
So like I said before, it'll prolong how long, it'll preserve the body after arrest. So if somebody's found in like a cold water situation, there's been multiple reports of patients recovering after being drowned in cold water for up to an hour. So viability is definitely improved by the cold weather.
As far as viability is concerned, you talk about doing your assessment. What are sort of the steps that go into your assessment?
So we're looking at obvious signs of death. So we're looking at exposure of brain matter. We're looking at traumatic injuries, decapitation, things that would basically be non-life sustainable. We're looking at signs of lividity
Oh my
and rigor
God, come on.
to basically show us how long the patient has been down for.
And the age of a particular patient, what, if any, relationship does that have to your assessment?
So it'll show the extent of frailty the patient has. If somebody's an elderly patient, severe cancer patient, their ability to sustain a cardiac event like that is less. So somebody that's younger or middle-aged will have a much better chance of recovery afterwards. But that would really be the only key that we're looking at.
And what, if any, observations did you make of Mr. O'Keefe during your assessment of him initially?
Just that he was a middle-aged male, and that was all we had.
And as far as the other things that you're talking about, as far as viability or resuscitation, what, if anything, did you observe with reference to Mr. O'Keefe in regard to that?
So with viability, we were looking at any rigidity or rigor in the body, or lividity or separation of blood. You would have a pooling of blood or bruising, it would look like, at the lower parts of the body, depending on how the person's positioned. Basically, if they're supine, you'd have positioning or pooling underneath the body. And then you would have stiffness of the arms, legs, jaw, neck. To be able to move the body, we're looking to, if they don't have those things present, it's another check mark of saying this is viable, we can work this.
And specifically as it applies to your assessment of Mr. O'Keefe, what, if anything, do you recall in regard to that initial assessment as far as viability?
So his limbs were able to be moved, jaw was able to be moved. The posterior of his body was red, so not the indicative of lividity that we're looking for. So he termed it to be a viable arrest and continued to work.
You mentioned as far as sort of gathering your equipment, bringing it over to Mr. O'Keefe, what if any equipment did you gather?
So equipment initially is going to be our scoop stretcher to be able to pick the patient up, break apart, put it underneath him. We have our first in bag, an airway bag, cardiac monitor. We'll bring all that over to the patient's side to be able to do as much as we can in that situation. But due to the weather, we wanted to get him out of the weather because that was one of the things that was hurting him at that point, is getting him into the warmer ambulance and beginning the warming process. So get into an area where we can assess the patient thoroughly with good lighting and to be able to expose the patient, begin the warming process.
And when you go over to where Mr. O'Keefe is, about 10 feet off the roadway, who, if anyone, from your department goes along with?
So I have Matt Kelly with me and Tim Nuttall. I also have Frank Walsh, Katie McLaughlin, and Greg Woodbury, and Captain Robbery.
And as far as this sort of initial assessment on the ground with Mr. O'Keefe, what, if anything, were sort of each of those respective people doing with regard to Mr. O'Keefe?
I'd have to review specific interventions as far as who did what, when. But that's why we document things immediately afterwards, so it's all fresh. So CPR was initiated by me and ALS assessment as well. So I can go over individual interventions if you'd like, but it's really a call.
And for the record, sir, you're looking at exhibit number 160.
No.
What page is
I
that?
want to know about that
It
incident.
says 205 of my EMS report, but there's also the ANFIRS report on the top as well.
So initially, when you go over to Mr. O'Keefe, how many other people are sort of in that area at that time?
So in the area, we have the first responders, and then we have the two female parties on scene.
Where were the two females in relation to Mr. O'Keefe?
So as we're approaching the scene, they were kind of in between us and the patient. So we tried to gather as much information as we could from them as we could.
Where's the third female?
So once you make that determination as far as viability of resuscitative efforts, sort of specifically, what are you and the other firefighters doing in regard to those efforts with Mr. O'Keefe?
So we're beginning CPR. We're trying to establish good quality CPR, get the patient onto our stretcher, begin an IO, start medication, start ventilating the patient. All this, all of the conditions that the body has, we're trying to remedy through intervention. So we're trying to breathe for the patient. We're starting to press on his chest to do CPR to cause his cardiac muscle to compress, spread blood through the heart, cardiac muscle, cerebral brain. And we're trying to reverse what's happening in the body.
Now, as far as when Mr. O'Keefe, you observed him on the ground, what, if any, snow did you observe on or around him in that area?
So the snow was probably up to the mid-axillary point. So we're looking at probably halfway up his rib point. Top of his body was clear.
And do you know about how much snow was covering
You
his
said
body?
he's like half buried in snow.
I'd say probably about 4 inches, 4 to 6 inches.
That's the first witness who said 4 to 6 inches. Everyone else has said a light dusting of snow.
Yeah, there was
Yeah.
nowhere near that much snow at that time.
4 to 6 inches.
So, oh, this is amazing.
Now, as far as your observations, Mr. O'Keefe, when he's on the ground, what, if any, observations did you make as far as how he was dressed?
For the exposure, I'd say he was pretty underdressed. Long sleeve t-shirt, jeans.
Well, now
So
he
nothing
was saying he
really
was underdressed.
substantial to be
The
out
other
in
guy
that
said
type of
he was
weather.
dressed for the weather.
And
Now
at
he's
this
wearing a
point,
long
or any
sleeve
subsequent
t-shirt.
point, what, if any,
Went from a
observations did you
hoodie
make
to a
of
puffy
Mr.
jacket
O'Keefe's
to a long
football?
sleeve t-shirt.
By the time so our first priority is obviously going to be treating the patient. His clothes do matter, but it's on the list of priorities, not huge. So by the time we figured out he was missing one of his shoes, we were already at the hospital at that point.
And you recall which of his shoes he was missing?
I don't.
And as far as that missing shoe, was that something that you or any of the other firefighters, paramedics were needed to have removed on scene pursuant to any sort of
Do you like
treatment?
black people?
Nothing would have been done through the feet. It would have been just exposure of the patient to see possibly the extent.
No, we determined on Tuesday this is Ricada's cousin.
A frostbite, if it had
Younger,
started
better
affecting
looking cousin.
extremities, fingers, nose,
Yeah.
that type of thing,
Yeah.
hypothermic reaction.
You should
there.
take a screenshot and send it to
Would
Rick.
that be something that would have been removed by one of you or one of the other firefighters while he was on the ground?
If it would have been removed, both of them would have been removed. To assess that, it wouldn't do much good to just remove one and leave it there on scene.
Now, as far as the two females that you observed, did they sort of remain in the same position you initially observed them? Did they move around or something?
They kind of cleared a little bit away from the scene. I would say they moved off to the right of the apparatus so we could work on the patient at that time.
And what, if any, conversation or what, if anything, did you ask either of those two?
So how the patient was found and what brought them to that situation is critical. So we're trying to figure out as much information, past medical history that we can of the patient. So we're trying to find somebody who has knowledge of the event. So as we approach the scene, begin to talk to one of the females. What is going on? Why are they there? Just what happened?
And you say you're speaking of one of the two females, is that correct?
That's correct.
You see any of those females in the courtroom today?
That's correct. Miss Reed.
Could you just identify as to where Ms. Reed is seated or an article closed?
Right there.
I can just ask the record reflect identification.
Okay.
With regard to one of the two females that you were talking to, was that Ms. Reed or was that somebody else?
That was Miss Reed.
And why, if at all, were you talking to her versus one of the other females that you observed?
She seemed to be the one that was most personally affected by it, so figured she'd had the most information about why the person was there.
And what, if any, observations did you make of her in regard to your conclusion that she was the one who seemed the most personally affected by it?
She was the most distressed on scene, obviously upset, so personally related to or had a kind of relationship with the person.
Before we get to conversations, what, if anything, did you observe Ms. Reed or any of the females doing with reference to Mr. O'Keefe's body when you first started to come up to the scene?
So I would characterize it as an attempted resuscitation. She was attempting to do CPR, but due to the erratic behavior, she was running back and forth between the other female on scene and the body, back and forth, trying to press on his chest, wake him up, talk to him, just to no avail.
And as far as your conversation with Ms. Reed, what, if any, questions asked in regard to the demographics or anything else?
So do you have any information of who this is? How are they here? Tried to get any type of information we could from her at that time, but with no luck.
But
You
your
say
body,
with no luck, what, if anything, what, if any, response did you receive from Ms. Reed in regards to your question?
So the only response that I was
hit him, I
personally
hit him, I
given
hit
was
him.
just, I hit him. Oh my
He
God,
was
I hit him.
personally given, or did he hear it?
Yeah.
And when she's saying, I hit him, oh my God, I hit him, how loudly is she saying?
So she was within 2 feet of me, but very loud. Any type of follow-up questioning, did you hit him with your hand? Did you kick him? What happened? She just repeated the phrase over and over again, I hit him, I hit him.
Mm-hmm. No one else at the scene other than the EMTs heard that.
Weird.
Yeah.
And just to be clear, where does this conversation occur?
This was as we're bringing equipment over to the patient. The interventions are going to be started basically by whoever gets over to the scene first. I'm trying to gather information as a lead paramedic to try and coordinate interventions and therapy to kind of holistically be the team leader in that situation and treat and transport the patient. So it was on approach to the patient, probably halfway between the ambulance and the patient.
And with regard to that treatment of Mr. O'Keefe, I think you referenced it earlier being within your report. What were sort of those steps or what, if anything, did you and the other firefighters do with regard to treatment? Before you answer that, Your Honor, may I request, may the witness just refer to the EMS report as you go?
Yes, if need be.
Thank you. So we try and document through our flow chart of all of the interventions that we're doing. So CPR is obviously going to be our first priority. CPR is initiated, unchanged but successful in the actual intervention itself, no complications. We do our ALS assessment that we talked about of any further indications of this is not a viable arrest. We determined it was a viable arrest and we move on. Then we're going to start, we refer to it as a bag valve mask at 15 liters per minute on oxygen. The patient's not breathing on their own, so we're trying to assist ventilating that with high flow oxygen as well. And easy IO, which is a needle we put into the bone of the tibia of the patient. That was on that right tibia was the first one we put in. We're going to be putting in warm fluid. We have a warmer in the back to be able to bring up the core temperature. Then we start with epinephrine.
Yeah.
1 milligram through that IO. If I could just stop you there for 1 second. When you say as far as IO, put it into the leg, how is that sort of inserted into the leg?
So we have two different methods we can do. We have a drill, a power drill that drills through the outer layer of the bone into the capillary area of the bone, the soft, spongy material. So we drill through that, or we can do it by hand if that fails.
And when it comes to the epinephrine, what is sort of the purpose of that medication? What are you trying to do with that medication?
So that medication will improve, it's a vasoconstrictor. It'll cause the vasculature to constrict. So it'll improve the quality or effectiveness on the cardiac muscle, cardiac vasculature, and the cerebral area.
So as far as the administration of epinephrine is concerned, is that something that's done once or more than once? And is there a protocol for that?
So it's going to be serial every 3 to 5 minutes during the cardiac arrest to try and bring them over to the hospital. So it continues that entire time unless there's a rhythm change or that can change our algorithm of how we approach the patient. If there's a rhythm regain or return of spontaneous circulation.
And so how many times or what times was the epinephrine administered via the IO to Mr. O'Keefe?
So I have epinephrine at 620, 625, 630, 635, 640, 645.
Dang.
And when was that first administered? Would that have been at some point when he was outside of the ambulance on the ground or in the ambulance or something?
It would be dependent on transport time.
So now we're just reading a report. This is
riveting.
Yeah.
Well, they're not supposed. He's not supposed to just read a report either. He's supposed to refer to it and then speak. He's not supposed to just read off this report.
No.
And again, excited utterances.
So first, we're at patient side at 6:15.
Evidence.
Transport 6:27. So best estimation would have been inside of the ambulance at that point.
I'm sorry to interrupt you before, but after sort of the introduction of the epinephrine, what if anything did you and the other firefighters?
After the first round? Yeah. So first round of epinephrine. After that, we would drop in what's called an OPA. That would be to push the tongue out of the way, open up the airway to improve our bag valve mass so it has an open air way to get the oxygen into the lungs.
Again, this has nothing to do
We
with
begin external warming, stripping the patient.
Talk about the scene. Talk
getting the
about
heat turned up in the back of the ambulance.
what you saw.
We would then switch over from manual CPR done by hand to a mechanical CPR device to ensure adequate, consistent CPR compressions of the chest. It was a Lucas device. Put that on the patient. And then we continue with another round of epi. Patient's starting to warm up this time, so we would do suction at that point to try and suction fluid out of the airway to improve ventilation efforts. Another round of epi is done. We have another suction, this time through a deep suction via the endotracheal tube.
Why are we listening to
At 6:22 after warming, we intubated the patient. We have a 7.5 tube to paste at 27 centimeters, and then verified through various means, through chest rise, auscultation, waveform, and tidal CO2.
Stop reading.
So we had complications listed as patient vomiting, aspirating. Suction was then done with a rigid tip suction device. After successful intubation, we then suctioned via French tube through the airway established.
A French tube, so it's a retractable.
Jump back up to 6:31. Another IO line was established on the opposite tibia on the left side.
One of those auto-retracting ones.
And then another 3 rounds of epi, and then
It
arrival.
only goes in backwards.
What was the arrival time?
Couldn't they just admit the report to evidence?
At destination was 6:45.
What hospital was that again?
Nothing about
Good
his
Samaritan
report is going to be.
The term that you use in your report is called, and I'll probably butcher this, but asystole, is that correct?
Yeah, asystole is going to be a cardiac rhythm where there's no electrical activity in the heart and is referred to as flatline.
What, if any, observations did you make in your treatment diagnosis in regards to Mr. O'Keefe as far as asystole?
Nothing that he
So that was the rhythm he was found in.
In contention.
Yeah, from initial rhythm I have on the EKG at 6:32 is asystole. So we basically observed that for any changes, whether it's increase of electrical activity, regain of adequate pulses, all that can kind of be hinted at with the cardiac rhythm. And then we would change our algorithm based on whether we go down the ROSC protocol or we continue down the cardiac arrest protocol.
And whether it's on scene or it's in the ambulance, is there sort of a division of tasks or division of different skill that's being employed in patient care?
So patient care will have to do with level of training and also proximity on the patient. Where you get into the ambulance is just logistically, if you have the training, it's not a huge open ER, it's a small environment. So we try and not have people jump over each other as best as we can.
And if you recall, who was sort of doing what in relation to treatment of this patient?
So in the back of the ambulance specifically?
Yes.
Okay, in the back of the ambulance, Tim Nuttall was managing the airway. I was the team lead that was kind of coordinating all of the interventions. Matt Kelly was assisting in gathering equipment, doing CPR before the mechanical device was placed on. Basically, they act as an assistant to hand equipment, place things in strategic areas around so we can actually work without having to go get those physical things ourselves.
Now, as far as you indicated removal of Mr. O'Keefe's clothing was in the ambulance, correct?
Yes.
What was it about sort of the condition of the clothing that led to the removal of that?
So removal of clothing is actually pretty standard for any cardiac arrest, any traumatic injuries. We're basically trying to get further clues. This is all happening very quickly. So we're trying to get more evidence of why are they here. We're looking for extremity injuries, crush injuries, bruising, anything that we could document, that we could pass on to the emergency room staff and doctors. So we would strip most patients.
And as far as were you involved personally, as far as sort of cutting the clothing and stripping the patient?
Yes.
And upon removal of the clothing, what, if anything, did you observe as to sort of the condition of the clothing, the texture of the clothing?
Condition seems pretty well intact, but just wet and cold.
And what, if any, relationship would the wet and cold clothing have to any of the diagnoses that you were running through in regard to those?
It would really just be the exposure to the weather would be our biggest trigger off of that, or if you had protruding injuries through the clothing, compound fractures, things like that. The clothing was intact, but we knew it was wet, it was cold. So as we strip things off of him, we can see underneath basically if there are any not every fracture breaks through the skin, not everything causes obvious things, obvious signs. So as we strip the patient, we can begin to further assess.
Take you back just for a second to outside of the ambulance.
Yep.
What, if anything, specifically were you able to observe with reference to any injuries Mr. O'Keefe sustained?
Injuries are pretty tough to see outside of the ambulance just due to the weather, due to the lighting. We have seen lighting on the ambulance as well, but
let me ask you
Yep.
this, as far as what, if any, difference did you know between the lighting in the back of the ambulance versus when you were with Mr. O'Keefe on the ground?
So he was still out in the weather at that point, so bleeding wasn't really obvious at that point. As soon as we get him into the back of the ambulance, then we start noticing hemorrhage from different areas of his body.
And when you say hemorrhage from different areas, which areas?
Old line
So
red.
mostly from his mouth, his eyes, nose. Yeah.
And just to be clear for the record, when you use the term hemorrhage based on your training experience, what do you understand that?
Bleeding, external bleeding.
Now, you mentioned that there was some suctioning of Mr. O'Keefe's airway, is that correct?
Correct.
And what, if anything, specifically was suctioned from Mr. O'Keefe's?
Suctioning from the airway was mostly blood, blood, sputum.
And as far as how much, what if anything you have to sort of measure how much blood was suctioned out of Mr. O'Keefe's airway?
So we have a canister that has marks of milliliters, so we can determine as we're suctioning how much is in that container at different times.
The superior measurement.
And about how much, based on that, was suctioned from Mr. O'Keefe's airway?
So the initial suctioning with the rigid tip was about 150 milliliters. And subsequently,
Jamie, why are we watching this? Why are we watching this?
I really want to understand the dynamics of the EMT world. This is amazing.
Yeah, the suction from his throat has what to do with what?
I don't know.
This is gonna be
I'm
a long
waiting for
day.
him to
and it's only a
Let's
half
go
day.
back to the beginning of your college career, sir.
Yeah,
Let's start talking about.
you said milliliters. As we are Americans and don't understand measurement, could you please describe to the jury how, why, and what a liter is? A milliliter is a centiliter, a microliter.
so that
Give
would
him
have
time.
been
He'll get
above the
there.
airway in the
He'll
mouth
get
in
there.
that type of area. We
He'll get
established the intubation, and then deep suctioning with that
And this
soft
is on
tip through the intubation tube
1.25.
would have been another 50 milliliters of fluid.
Now, with reference to, you mentioned some observations in Mr. O'Keefe's back, correct?
What's that? Sorry.
You mentioned some observations you made earlier in reference to Mr. O'Keefe's back.
Yes.
And what were those again?
So that would have been redness of the skin and the posterior of the body.
What, if any, significance does that have to you as far as your observation?
So redness from the skin, if it's general across the body, can mean
Liar,
three things.
Danny.
If it's just a particular area, and due to the fact that it was cold outside, that would have been the initial stages of frostbite or exposure to cold.
And as far as the remainder of Mr. O'Keefe's body, what, if any, other observations did you make? In which areas did you make those observations in regard to the initial state?
So for as far as the cold exposure, the cold exposure, we're looking at the most exterior parts. Extreme cold exposure can lead to frost nip and frostbite in different areas. The first affected areas are going to be your fingers, your ears, your nose, your toes, that type of. So that was a cold, waxy, pale, stark white substance, basically, or condition of the skin.
And on each of those areas that you just described?
Yes.
Now, sort of up in the area of Mr. O'Keefe's head, you mentioned some bleeding from the eyes and the nose, correct?
Yes.
As well as his mouth.
Yes.
And beyond that, what, if any, observations did you make of any other sort of injuries to his head or his?
So his eyes were pretty well swollen. We were trying to clear areas of blood to figure out if there were any contusions around the head. I believe there was a contusion on his forehead. Also had some markings on his extremities as well.
And just as far as your understanding based on. your
And they
training
missed
and
the
used
neck
for-
wound
what do you
again.
understand?
Bruising.
And before we get to the extremities, what, if any, observations did you make as far as Mr. O'Keefe's abdomen?
Abdomen we noted as significant as distension or swelling of the belly.
And what, if any, significance did that have to you in regard to Mr. O'Keefe?
It's another of our detailed assessments. We go through the body in a more detailed way to try and find more clues that we can pass on for the assessment.
He's not the
Distension in the
ME,
belly
like,
could be due to
move
trauma
on.
or bloating. It could be, those are usually our biggest triggers for distension.
Now, you mentioned as far as the extremities are concerned, what, if anything, did you observe as far as injuries to Mr. O'Keefe?
So we're looking at, so we had the cold, rigid fingers, hands, feet, and we had multiple dry blood lacerations to the right arm.
Lacerations.
Recall specifically where on Mr. O'Keefe's right arm?
Would have been his upper arm.
That's
And you mentioned
Not
dry,
correct
is that correct?
either.
Yes.
So these were not actively bleeding at the time that you observed them?
No.
Now, as far as dry
Laceration
blood
due
versus
to
actively bleeding, what, if
blunt
anything,
force trauma.
indicates to you
Happens
as
all the
far
time.
as
Happens all the time.
So we had active bleeding from other
on
areas in the
soft
body.
tins- yeah,
So
on
the
soft,
fact that it had already
tissue.
stopped and clotted, I would assume that would have been several hours before the incident that led him to be there, but I would guess earlier in the evening.
That was good.
Good one, Dory.
Because they have absolutely nothing else.
They really
And
don't.
again,
Now, as far as
two
the history of,
first-class EMTs didn't notice
your
a
attempts on
head
scene, and
wound.
then what if any attempts were made?
Skull
in
fracture,
the ambulance?
head wound, not like a
Okay,
little
sort of
bitty
history
head
of
wound.
how Mr. O'Keefe be there, or what if
A 2.5 to
causing
3
it.
inches long head wound.
Once we
That's
get
not
the
a
patient
problem.
into the ambulance, there was no family, no bystanders in the back of the ambulance, so then it's going to be solely based on physical assessment.
Hey, 3 inches is
and
big.
within sort of the team of firefighters that you had, who, if anyone, did you direct to try and obtain that information while you went back?
So that would have been Katie McLaughlin.
And what did you ask Mr. McLaughlin?
So Katie was one of our senior paramedics at the time. So we had enough skilled hands working on the patient at that time. So to direct her, I wasn't able to get as much information and still had a skill to do, or still had a task to do, to run the cardiac arrest. So I directed Miss Reed over to Katie to try and gather more information as to why they were there. If you could get any more information about who he was, events leading to the injury, how long he was down for, any type of information, and then moved on to the patient at that point.
And so firefighter McLaughlin is having this conversation outside of the ambulance, is that correct?
That's correct.
This is going on while you're inside of the ambulance, actively treating Mr. O'Keefe.
It was a very quick process. So I start the conversation, wasn't productive, wasn't moving forward, moved her over to firefighter McLaughlin, continued on to the patient, and then started treatment, moved the patient in, and then Katie came into the back of the ambulance to help. So it was a very quick process.
Now, as far as Mr. O'Keefe's eyes were concerned, what if any observations further did you make as far as Mr. O'Keefe's eyes?
So both eyes were swollen and bleeding.
What if any observations were you able to make of his pupils?
I'm sorry, what?
Pupils?
Pupils. So I've documented as 4 millimeters and non-reactive.
What if any significance is those observations as far as that 4 millimeters non-reactive?
So we're looking for equality between the two. So signs of bleeding can be demonstrated by unequal pupils, or if they were restricted, could lead us to believe it was as a result of an opioid interaction. But we're looking at whether they react to light as well. If there's brain activity, if there's still something causing the body to react, you'll have some type of pupillary response. So we shine light, there was no response, so it was fixed and at 4 millimeters.
Now, at some point, you leave the scene en route to Good Samaritan, is that correct?
That's correct.
And who is continuing treatment of Mr. O'Keefe in the back of the ambulance during transport?
So back in the ambulance and transport, then firefighter Kelly, firefighter Nuttall, and myself.
And so if anyone was driving the ambulance between Fairview and Good Samaritan?
So that'll be determined by basically just positioning on the engine. So the step driver for that position would then drive as the detailed person over to the ambulance, and that was firefighter McLaughlin.
Now, during the transport from Fairview to Good Samaritan, what, if anything, are you and the other firefighters in the back of the ambulance doing as far as continuing treatment of Mr. O'Keefe?
So we started transport at 6:27. So between 6:27 and 6:45, treatments included epinephrine, additional suctioning, managing the airway, placing another intraosseous line, and then 3 additional rounds of epinephrine while the mechanical CPR is continuing CPR.
And during the course of the transport, what, if any, changes in Mr. O'Keefe's status as far as cardiac arrest or breathing occurs during the transport?
No changes.
Now, that time that it took to get from Fairview to Good Samaritan, is that sort of a typical transport time?
Not normally. Due to the weather, it was pretty slow driving, even though the ambulance was a smaller vehicle than the engine. Slow transport compared to normal.
And during the course of the transport, what, if any, communication are you having with Good Samaritan in regards to Mr. O'Keefe and his eventual arrival there?
Every medical that goes on, we try to give the hospital staff a heads up, basically, of what's coming in. We'll have different alerts that we would give them, whether it's cardiac arrest, a stroke, a STEMI, to have the certain appropriate teams come in and be ready, whether it's a trauma alert. There's different specialties within the hospital that'll treat those different particular cases. So we call them 5 to 10 minutes prior to give that team time to get down into the emergency room to get ready to work.
When you arrived at Good Samaritan, with anyone were you met by, and sort of what happened with regards to Mr. O'Keefe's staff?
So we're continuing interventions from the ambulance through the bay into their cold room. We're then met by registration, a registered nurse, and the doctor that took care of the patient, as well as a team of other assistants and CNAs.
And where do you sort of, you physically go with Ms. O'Keefe, or how does that work?
Yep, so that's referred to as a transfer of care. So there's different people, like I said, it's a team base where different people are in charge of different things. We'll have the nurse in charge that's in charge of documenting our interventions that have been done so far, time of down, the patient was down, and then she starts documenting all the different interventions that were done by the hospital staff as well. You also give a report to the doctor, who's then taking over as lead for the cardiac arrest. They're going to start issuing orders for the patient and treatment. And then you have registration that will get the information to register the patient that they can tie all of their interventions to.
And during that sort of process of exchange of information and things of that nature, what, if anything, did you learn in regards to the core body temperature of the patient?
So to add that assessment, I believe it was a core body temperature of 80 degrees.
What, if any, significance does that have in regard to the typical core body temperature?
Typical core body temperature is going to be in the high 90s. Where body temperature being at 80 with a rectal temp or core temp is going to be extreme hypothermia.
Did he say 83 degrees?
No.
And it's
You're at Samaritan for a certain
closed
amount of
caption
time,
is at
correct, before you
8.
quit? And at that point in time, while you were at Good Samaritan, that initial time, what, if anything, did you learn as far as status or what happened?
So as we talked about before with the hypothermia and the extreme cold, they're going to work that for an extended period of time. Most cardiac arrests, I will try and hang out by the patient or in the area. As new staff come through, different things are found. The doctors and nurses might have follow-up questions. So I try to stay available as an asset that they can bounce those questions off, at least for 10 or 15 minutes afterwards, make sure the whole process is completely transferred from all the interested parties.
Yeah, let's hear where you told them he was hit by a car. She told us
She
that.
said she hit him. Yeah, that's what I was gonna say. I was like, what did you tell him that she claimed he was hit by something?
And during that course of time, what, if anything, did you learn?
It's Fahrenheit.
80
80 degrees Celsius. He would almost.
We didn't learn anything while we were at the hospital. We then cleared the hospital, returned back to quarters to decon the ambulance and to replenish all the equipment that we had used, get back in service, and move on with the shift.
At some point during the course of the shift, did you have occasion to go back to Good Samaritan?
Me personally, no. It would have been for an additional medical call if there was any calls for service afterwards.
Did you recall whether or not you went back to Good Samaritan for any additional medical calls or anything of that nature?
I don't recall.
So if I could direct your attention to the screen just over there.
Lally, wrap it up.
This
Oh my
is,
God.
exhibit number 9.
Do we see the correct? Oh no, we don't see the correct tail light. I hope we hear her admit, "I killed him. I killed him." I
So
heard
direct your
it.
attention to what's been previously marked as exhibit number 9 on the screen. You recognize what's in that photograph?
Again, not
the
representing
house.
the scene.
Is that the house
It's not
you
the scene.
responded to? Is that correct? And Ms. Gilman, if I could have exhibit number. Ms. Gilman, if I could have exhibit number 14. Again, sir, what's up on screen? Do you recognize what that is?
Come on, people. What's this? What is this? It's. I can see two footprints and something red. You can't say what anything of this is. And taking a picture of the house down the road, and not. Why don't you show how far from the road the crime or the incident happened? This is useless. Sorry.
I see blood, snow,
Yeah.
general
Half day.
area, not so.
And where's the pool of
And
blood?
lastly, Ms. Gilman, if I could have exhibit number 18.
Where's the pool of blood? Come on, show us the pool of blood.
Yep.
And again, firefighter for money. You recognize what's picked up on screen as exhibit number 18?
Yes.
Can I go to the front?
Yes.
They just asked them if they could
Sorry, maybe
recognize
raise
it.
the pointer. Basically, just press on this button here. This direction on the screen. All right.
Thank you, Jude, for being a member
So,
for 6 months.
part of
More
my-
than that,
within this
not
photograph
going
on
anywhere.
Exhibit 18,
Yeah.
do you see the area in which you observed Mr. O'Keefe supine on the ground in the first lap?
Yes.
And using that laser pointer, could you direct the jury's attention to where in this photograph you observed Mr. O'Keefe?
Tomorrow there should be court. They are going on a field trip, but I can't see it taking more than half the day. So I'm hoping we have court in the afternoon.
Yeah. It's supposed to be a full day.
Initially arrived would have been in this area here.
Yes, that flag is at half mast because there's an American flag on top.
Yes. If you could turn, thank you.
Nothing further for this witness at this time. No.
All right,
thank
cross-examination.
Thank you.
No.
Good morning.
Good morning.
I'd like to start sort of at the beginning. When you first arrived at the location, you indicated that you could, in fact, see the body from your perspective, correct?
I can see a body, yes.
And I think you indicated the shape of the body.
Yeah.
Couldn't tell if it was female or male.
Nope.
But obviously looked like a human figure.
Yes.
Okay. That drew your attention to the left side of the ambulance as you were approaching, correct?
Yes.
And you're sitting on the right side, which means you're sort of the furthest away from that figure from the perspective of the ambulance.
In the ambulance, yes.
And you had no problem making out that figure in the snow.
So figure in the snow, we had a good distance between the ambulance and the engine, so yes.
Okay. And you indicated that the figure in the snow was on top of the snow, if you will, with some snow accumulating up the body of the individual.
Yes.
But he was not covered in snow.
No.
There wasn't like a mound of snow over this figure.
There were mounds of snow in the area, but not over the patient. Due to the wind, there were snow drifts in the area.
And his clothes were dark as compared to the white snow.
Yes.
Good question.
I want to ask you a couple of quick questions about some of the last conversation you had with Mr. Lowry about the injuries. You did note that Mr. O'Keefe had a laceration over his right eye, correct?
No, over his right eye?
Over his right eye.
The contusion over the eye.
Okay, and your definition of a contusion is?
Bruising.
Was it also swollen?
There was swelling around the eyes and a little bit of contusion and bruising around.
Did you see an actively bleeding laceration over his right eye?
I don't recall.
You don't remember that? What about his left eye?
Both eyes were pretty well swollen shut.
What about not from the nostrils, but on the skin on the nose? Did you note a laceration or multiple lacerations on the nose?
So due to the bleeding that was coming from the orifices, trying to clean the area and find exactly where it's from is sometimes difficult. So we can just say it was bleeding in that area.
Okay, so you can't define, as you sit here, you don't remember if it was bleeding from the nostril or from a laceration on the nose?
I believe it was the nostrils.
Okay. Are you saying that there was no laceration on the skin of the nose, or you just don't recall it?
On the top of the nose, no, I don't know.
I'm sorry.
On the top of the nose, I don't recall.
You don't recall. Okay. With regard to his abdomen, you indicated that it was distended,
Yes.
a medical term for swollen.
Yep.
You said that could be from trauma or it could be just bloating, correct?
Correct.
Did you notice any contusions on his abdomen?
No.
Any skin that was abraded?
No.
Or cut?
No.
So there was no bruising, no contusion, but there was a distension, correct?
Yes.
So there was no visible trauma to the abdomen.
Visible trauma doesn't really matter to internal trauma. It's not always indicative one way or the other.
So my question was, did you see any visible trauma on his abdomen?
No.
Okay. But you did note that it was bloated.
That it was distended, yeah.
Okay.
Maybe he was just chubby.
I want to talk to you for a second about, if I could shift gears.
You've been
about
drinking
the
all night? I get a
conversation
little bloated
that
after I've been drinking
Mr.
all
Lowry
night.
that you had with Ms. Reed. You were also asked about that conversation at the grand jury when you testified, correct?
Correct.
You testified that as the lead paramedic, you were specifically trying to get as much information from my client, Ms. Reed, as you possibly could concerning the victim and how the victim ended up being there, correct?
Correct.
You indicated in no particular order that you asked questions like, how do you know him, correct?
Correct.
How did he get here?
Correct.
What happened?
Correct.
Is there any additional information you can give me about what happened to this person?
Correct.
Okay, so that was a conversation that you were personally engaged in with my client in order to gather as much data, if you will, about what you were dealing with, correct?
Correct.
But your focus was, when you first arrived, your focus is, I need to attend to the patient, correct?
Correct.
Like, conversations notwithstanding, I need to deal with what's in front of me, which is an unconscious man in the snow.
Correct.
Dressed inappropriately.
Correct.
And possibly freezing to death.
Correct.
But you did say that you had enough of a conversation with Ms. Reed that she answered you and said something to the effect of, I hit him, oh my God, I hit him.
Correct.
So then you followed up on that conversation, correct?
As much as I could, yes.
As a matter of fact, you said that you asked her additional elaborating questions.
Correct.
Well, did you hit him in the face? Or did you kick him? Or did you hit him with your hand? Okay. So that's a conversation that you're having with Miss Reed face to face.
Correct.
You're talking to her, you're looking her in the eyes, she's looking you in the eyes, you're standing still, and you're attempting as best you can to converse with this woman so that you can gather as much information as you possibly can as you attend to the victim.
Correct.
You indicated that that conversation lasted long enough that the conversation was frustrated by the fact that you weren't getting information that was helpful to you. So you turned that conversation over to Katie McLaughlin.
Objection? Sustained. Ask
Mike.
it a different way.
Sure. Did you have, was your conversation in some way in your mind, and when I use the word frustrated, I mean, it was just, you weren't getting the information that you were seeking, correct?
It wasn't productive.
Okay, better way to put it, I'll use your word. That conversation was unproductive enough that you then moved the conversation over to Ms. McLaughlin, correct?
Correct.
Firefighter McLaughlin. And once Firefighter McLaughlin engaged Ms. Reed, you then began to attend to the patient again.
So the patient was already being treated by the other personnel on scene.
Okay.
I started the conversation, realized it wasn't going anywhere. I had other responsibilities. So regardless of how they ended there, they still needed treatment and transport. So that began my priority and moved her over to try and get as much information while treatment was being done.
There is allegedly a broken tail light, which we have a lot of problems seeing. Looks like my camera's about to crap out again. What the hell's going on?
Mine does that too.
What part of the treatment were you responsible for?
All of it.
Sorry, that's a great answer to a very vague question.
Yep.
What physically were you doing with Mr. O'Keefe?
In which particular moment?
When you first arrived and attended to him and physically touched him. In other words, were you the airway person? Were you the cardiac person? Were you doing chest compressions? Were you squeezing the bag?
I would have been doing chest compressions initially until I could delegate that task to somebody else.
Okay. And chest compressions, I'm going to butcher this because I've never been trained other than my little toddler. They look a little like what I'm doing now, correct?
Correct.
And I indicated palm over one palm over my hand, arms extended, and you can see my shoulders moving up and down in a rhythmic fashion, correct? So if I didn't get an answer, correct?
Yes.
I'll wait till then. What were you wearing?
What was I wearing? My uniform.
Didn't expect that one, did you?
That was a different one. Heavy winter coat.
Okay.
The uniform.
Do paramedics wear sometimes yellow, bright yellow for safety?
Yes.
Were you wearing a bright yellow, heavy winter coat?
I don't recall. I have a few different coats.
Got it. Do you remember what Miss McLaughlin was wearing?
I don't.
Okay. That conversation that you had with Ms. Reed at the scene, that had to have lasted, I'm not guessing it was very long, but it had to have lasted a minute?
At most, yeah.
At most? Once you finished your conversation with Ms. Reed, did you then start attending specifically to the chest compressions and the high-level CPR that we've heard so much about from your colleague?
Yes.
As you're doing the CPR on the scene, that high-level CPR, high-quality CPR, was Mr. O'Keefe then moved to the scoop, which would then facilitate getting him on a gurney?
Correct.
That gurney was then moved between a couple of patrol cars, cruisers, and into the ambulance, correct?
Correct.
once you were in the ambulance, the first priority is to get this person warm. Is that right?
First priority is always going to be CPR. The secondary would be getting them warmed up.
Okay. So obviously when you got into the ambulance, you would shut the doors.
Sure.
There's a heater on in the ambulance.
Yes.
You never came back out of that ambulance after you got Mr. O'Keefe into the ambulance, did you?
No.
Okay. And you were in there with firefighter Nuttall at the time?
Nuttall and Kelly.
And firefighter McLaughlin was outside the ambulance doing whatever she was doing.
Correct.
Okay.
Initially, and then she came in afterwards to assist. Yeah.
And did I hear you correctly when firefighter McLaughlin got in the ambulance, she took over the driving responsibilities?
So there's two different compartments. They're not connected. There's a little window between the two areas. So she assisted with interventions in the back. And then after we had established everything we needed to on scene to begin transport, she then got out and then started driving.
Got it. Thank you. I'd like to play, first I'd like to have marked, I think it's already been marked, Exhibit 379. It's a video, a snippet of a video. It's probably 3 minutes long. It's not that long. I'd like to play that portion of the video for you. And when it's done, firefighter Nuttall, sorry, I'm looking at the wrong notes. Firefighter Flamati, which is not that easy to say.
Did a great job.
I'm going to ask you to show me exactly where on the video, if you can, that you had this conversation.
With the laser pointer?
With my client. Yes, you can use the laser pointer as you wish. This is just to orient you, if I may, Your Honor. The top, this. Let me see if I can do this. There we go. The top is a dash cam from one cruiser.
So I'm going to see counsel at sidebar for a second, please.
So now she has to protect them again?
Yeah, what's she yelling at him about now?
Yeah. Well,
imagine how many times she tells them to like hurry up and they can't do this. It's just so much, but then she lets Lally just go on and on and on. So
I think it's more now we're going to probably get evidence that they never talked to her, because he said, I had a standing conversation face to face with her.
Yeah.
I bet you that's what the video is going to show. He absolutely didn't have.
Well, I thought he mentioned that it was secondhand, like he heard it secondhand, not that he actually talked
he
to
was
her.
asked specifically, did you stand and talk to her? And he said, yes, face to face. Then I turned it over to the
McLaughlin.
female firefighter, McLaughlin.
Yeah. I thought I heard both statements. That's why I was confused, because I thought I heard him say secondhand, and then he turned around and like the next question he said he spoke to her directly. That's why I was confused.
No one objected other than the judge interjected herself in it.
Yeah, the judge called for a sidebar.
Yeah.
Yeah.
No, that's not the Jerry Mustang. That was John O'Keefe's brother and mom, I think.
For this, until we pause it, I'm going to ask you to focus your attention on the top dash cam video. Go ahead and play that. Can you pause it?
Actually, I need to see counsel at sidebar again.
Oh my God.
Oh, it's probably because he can't say anything about this is Karen Reed. This is because that's it's the jury who should interpret. It's probably something like that. This is absolutely crazy that they're not allowed to use this. It's
Well, let's see.
yeah. This is gonna be stupid. If they're not allowed to show the video evidence and say, because do you recognize this person? We know from another person that that was, I think the person with the fur was Roberts. So he can stipulate to that. It's put in by another witness. Yeah, please don't prove the state's case is wrong. I don't know why she keeps calling them up there. It could be really interesting to hear what she's saying. Yeah, again, they should be allowed to use this.
I think she was saying something earlier about how she didn't want basically she didn't want him to narrate what they were
Yeah,
seeing in
that
the
was
video.
what it is, I think.
I'm sure that's what it is, but
Yeah,
still.
I'm sure it's about narrating it.
But then you just stop and say, did you see this person? Is that the person you talked to?
Right.
No.
I know, but she's probably, Bev, she's probably like, you can't be doing that. Gotta make sure.
She didn't do that when they narrated how badly it was snowing when the state showed the dash cam.
That's a good point, Haley. The last time they narrated, they proved that Jen lied.
Yeah, that's a little problem in that one. Because again, she might not want a narration, but still, yeah. Because someone might be a little biased. So it's just crazy. Oh, and someone asked way earlier, did I hear that Lawn and Crim clip that there was DNA and hair on her vehicle back taillight? No, you heard Plevin say that there was a DNA and hair on the back of her car.
Folks, we'll take a 15-minute recess.
This is stupid.
All right, please.
Interesting.
So now she's gonna do what?
I don't know. She's probably
Yelling at him about something.
Yeah, I think it's you're not allowed to.
Hey there, Karen Reed trial watchers. You know what a lot of
Stupid court TV.
I muted it.
I gotcha.
Yeah, look who bought a Fisher King after I bought one.
Next Lego set, y'all. Kingfisher. There's only so many Lego sets, Baker. You can't avoid getting duplicates.
This is totally new, and I ordered it as soon as it came out, and then I haven't gotten it yet. But
you haven't gotten it yet?
No, because I have my pusher, and I haven't had the time to meet with him.
So technically, I got it first, is what you're saying.
Well, I paid for it before you. Well, I haven't paid for it yet.
So technically, you're the copycat, Baker.
Oh, you got the little 3-in-1 parrot.
Oh,
I was looking at that yesterday.
That was cool.
Have you seen that series of those 3-in-1 things, where I have the camera and you can get the roller skates and that? I like that one.
Yeah, we got the Mrs. Valhalla recently got the rain boot or the water pot for flowers.
Yeah.
With the flowers. Yeah, that one. I built that one the other day for her.
They're cool.
Yeah.
Yeah, I really want to know what the sidebars are. Today it kind of feels like we're missing Judge Mummy telling us in 2-hour details what the sidebars were about.
Oh, she's keeping it all secret.
Yeah. I was looking at that Giza pyramid, but as I always say, I have YouTube money. I'm not YouTube rich.
Yeah, there's just some of them are a little out of my budget.
Yeah, it's 1,000 Danish, so that's 250 or something like that. No, 200, roughly 200.
Yeah, something. It's 220, I think. I saw it the other day.
Yeah. They probably she probably can't do it quietly, so that's why they dismissed the jury.
Yeah, who knows?
Lefty, watch hours above 3,000. Well,
greater.
Now you just need someone to like you so you can get some subscribers.
Yeah.
Get Lefty some subscribers.
Where is Lefty in my chat? Oh, I can't do it from there anyway.
He was lacking 250 yesterday. Thank you so much. Oh, I can share this because they actually showed the video. This is the video they weren't allowed to show. And you can see Karen Reed is standing there. There. I should point on the wheels. Are they back in court and showing it? This should be Jen McCabe. This is the EMTs coming in.
Karen's freaking out.
Yeah. I want to see that conversation.
There he is. Oh, that's the wrong. There you
Yes,
go.
she was still on the ground. This is when the paramedics arrived at the scene. The bottom one was was one of the ambulances, and the top one is the dash cam from the first arriving officer catching Jennifer McCabe and Karen Reed in front of the car. And it's probably to show you how they had that face-to-face conversation.
Yeah.
Or when Nuttall was sitting on the grass and she came over and yelled into his face, "I hit him! I hit him! I hit him!" I bet you an
That nobody
NFL jersey.
seems to like tell anybody about. That's my whole thing.
Yeah. I bet you an NFL jersey you get monetized before me. Oh, for Dave's new channel. Sorry. Well, Dave sometimes have some content. You're just sitting there playing games. Well, it's fun to build the Lego. Yeah, that's the thing they want to bring in there, to show that these EMTs, one is lying about a shirt or a jacket, and the other one apparently is lying about a conversation. And this is the size of the head wound. None of those first responding EMTs noticed on the back of his head. This is 6 centimeters. Or what we call a good day.
God.
They didn't notice this with their very, very extensive education. This is where all the puddle of blood came from. The puddle of blood we can't see in those pictures they took off the snow.
You would think that there's some blood coming out of the back of his head, right? And I know he's frozen and he's not bleeding much, but like when you lay the back of somebody's head on a gurney, right, it's going to leave blood there. If you're adjusting somebody's head to like put the trach tube in, right, you're going to get blood on your hands. Like I don't understand how they didn't notice this man's skull fracture as they're working on him. It doesn't make sense.
Well, I never said I was a creator, but doing my 1 hour and 36 minutes, I've still spoken more than you do in 8-hour stream. The head wound could. What the F is going on with my camera?
Oh no.
Oh.
That's a new display.
It was doing it while we were
there he is.
backstage too.
I don't know why it started doing that. I turned the frame rate and everything down. I restarted it 3 times. Maybe my something is needing an update. And now it's real slow. Yeah. The head wound could have been missed if there was no pool of blood. Well, the first responding EMT said there was a pool of blood. And one of the things you do when you examine someone, as you heard him say, we examine the body for any injuries that could potentially be important, would be to, especially when you have a busted up face, would be to examine the head. No one noticed he had skull fractures. Well, it could be a little bit hard to see, but no one apparently noticed he had a 2.5-inch gash in the back of his head that was open, which should have left a whole ton of blood because you were with us in parts of the Carolyn Tyler case. No, that was Shizzy. No, but she had kind of the same head after she fell down some stairs and landed in a basement. There's blood everywhere.
She was
The
like,
head bleeds so much.
it was
Yeah,
bad.
because it's kind of important that what's inside your head has all the blood.
Especially if you're drinking. If you've got alcohol in your system and you get a head wound, it just bleeds and bleeds. There's blood everywhere, y'all. It's dramatic how much blood your head can release over a tiny cut.
I don't know what we missed. I had it up the entire time. But I can bring up the part where they show the video again. She didn't say anything while we were there. But maybe we...
Yeah, but there's like no blood. That's the problem. It's not that there's not enough. Like there's nothing. They had 6 drops. That's kind of crazy. Because he wouldn't have froze immediately.
Yeah, Hannah, you're correct. His head wasn't injured there. His head was injured somewhere else because there would be blood. There'd be lots of it. It'd be all over the place.
She moves up to them now when he's on the board. And then it goes back. I can't hear them talking in court, so I don't know what we might have missed. The camera's not hot, so it's not that. It must be software related or hardware related. I don't know what we should have missed because I couldn't hear anything being said in court. And yeah, we then saw that conversation because the Mr. Not All said he was sitting on the ground intubating with the airbag while he asked her, looked up at her, asked her. Not according to this video.
Mm-mm.
And the other guy said, I was within 2 feet of her when I asked her what had happened. Just that it finished playing and then she called for 10 minutes. Well, we didn't see the finished thing and she called for 15 minutes. Okay, it's because LNC caught. Yeah, but someone told me I shouldn't use a smart TV. So yeah, that's why I didn't understand what someone was missing because there was nothing here.
Samus. Yes, there was a 2 or 3 inch laceration as well as the skull fracture.
Yeah. She was trying to find a way not to show the jury, but then after watching it, Jackson said, "That's all we were trying to show you, Your Honor." And Bev said in a very irritated voice, "Okay. Okay. Well, Smart TV, Lawn and Crim cut that out of it. But why didn't they want to show that? Because it's very important to show there was no contact with the EMTs as they stated. No, you didn't sleep 12 hours because you said goodbye to me roughly 9 hours ago. She's just wasting time.
Did you guys have a magical night, Baker?
No, not really. It ended abruptly. He had to go.
Ended abruptly.
Would you say it ended prematurely?
Yeah, I walked away unsatisfied.
Aw, not a good night.
Oh, expert.
Yes, there's half days, Tuesdays and Thursdays every week, and Bev will probably take. I'm going to Aruba trips, and I need a new haircut, and my dog stepped on a bee days.
I'm confused. Is there supposed to be court on Friday? Do we know?
Yes.
Okay.
But tomorrow will be a field trip.
Jury view. Yeah.
They're going out. They're going to a campsite, having s'mores, enjoying life, and that won't be televised because it could be doxing the jurors. So I'm hoping we'll start at 12 or 1, but I'm not sure. She will probably say, "Well, it's Friday, so just let's take an early day." It's not like we have anything to do. She also didn't appear to be running back and forth erratically between talking to the other female and attempting CPR. No, because that was another thing. She was back trying to do CPR, do chest compressions, according to him. She was standing still. Why are these? Because these two EMTs tells a very different story than the police officers.
Yeah, it's very weird.
And a very different story than the video.
Yeah. Where is Aruba? Near to Jamaica. Girl, I want to take you to Bahama.
I was just going through the song. Bermuda, Bahama, come on, pretty mama. Key Largo. Oh, gotta love the Beach Boys.
I need a keeper. I do have a keeper. It's Jamie.
Mm-hmm. And she'll fight you over it.
Yeah. What's happening?
I'm her little pay pick. She's not letting me go.
Your little pay pick. Oh, I wish I didn't have to work anymore. Get to work, Baker.
Well, yeah, Mustang. Literally everybody has had a different version of events so far.
Yeah. It's better than the Afro Man that Valhalla was humming earlier. I saw that video. See, he's not been playing many concerts, but he's probably been celebrating his Jamaican heritage a lot. He looked like a guy who got stung by a Twinkie.
Stung by a Twinkie?
Good Lord.
Yeah, they will be going to... no, they won't be going to the Waterfall Bar because that was... they're just going to Fairview 34. And that's why I'm saying it'll probably take, I don't know, anyone in Canton can tell me, it'll probably take them 10 minutes to get there or however. I don't know how far away it is.
Unless there's a blizzard.
There was snow in Canada yesterday, so we better stop driving around.
That's what I heard.
It's
well, it'd be good for them to see the lawn and everything because I think they're going to get a rude awakening of what it really looks like and stuff.
Yeah, but
the pictures don't do it justice.
No, because we don't know what the pictures are showing in any way. Is this representing the scene? No. Yeah.
Well, there's a lot of them are like angled weird, and it looks a lot bigger. And then in some pictures I've seen, it's small. It looks a lot. The lawn looks a lot smaller. So I don't know.
Donna Shepard, I think you're right.
It does seem that could be a possibility.
Yeah, I think they should just say, "Hey, Your Honor, could we just skip all of this nonsense and go to Proctor and Jennifer McCabe, and we'll be done by next Friday."
Yeah, I just want the Alberts, Proctor, Lank, Sergeant Lank. Let's go.
Oh, I want Proctor down the stand.
Oh, big time.
He's probably going to get Clinton before we get there.
He might. He might. That
No,
dude's
no,
involved
both-
in so many crazy cases.
And both EMTs have testified. She said it. The first one said, I was sitting on the ground and asked her. The other one said, I was standing within 2 feet of her and having a conversation with her. And now we're going to see a video showing none of that happened either.
Well, and everybody else so far has just testified that she was absolutely hysterical and wasn't making any sense and couldn't carry on a conversation at all. But these two EMTs, apparently, they got it. They got it done.
They heard a confession, but they never told anyone, and they never inquired what did he get hit with.
Yeah.
Did
No,
you
it's
hit him
just,
with
oh,
your
you hit
hand,
him?
car?
Oh, that's fine.
Yeah.
That's good,
Okay,
honey.
cool.
Yeah.
Good job.
Oh, a woman talking. Can you go to the side, let the men work?
Repeal the 19th. Go away, lady.
We have a female driver. That's enough woman for us. Get away.
God.
Can't have you standing over here too long. You guys will sync up. Get the hell out of here, lady. Oh.
I can't stream with you two.
Well, I have her on a screen with her where she's just constantly doing this while we're streaming. So they're always following me.
Yeah, I've got a big...
I'm working. No, she's just sitting in her room.
I've got a big 23 by 30 poster on the wall right there with Jamie just going like this at me.
Oh my God.
I put a scratch strip of vanilla anytime I get bored.
Does it smell like caramelized vanilla?
Yeah, it's a 5-minute drive without traffic. So I shouldn't say this because it'll just come through. She will say, so we'll take a half day because we have to get out of the house and it's going to be a long trip. So see you Monday. Bye. And then she can go to the waterfall and get hammered again.
Coming soon to Valhalla's merch store. Vanilla scratch and sniff Jamie posters.
No.
He stated that he had a conversation where he asked her that and multiple other questions within 2 feet of her. And we just saw a video showing he didn't. So that's why we went on a break right after they pulled that video up. I'm not sure.
The best part of these posters is that the scratch and snip strips in a different spot on every poster. You guys got to find it.
That's a whole new merch idea. I've seen plushies. I've seen small plastic figures, but scratch and sniff Jamie posters.
They'll sell like hotcakes, guaranteed.
I hate you.
David's already pre-ordered half a dozen of them.
No, he wouldn't. He wants to die by vanilla. That man.
Sadly, if he does that, he will be in breach of that buffer zone order because no one is allowed within 100 feet of the jury when they are out tomorrow. She released an order saying that this morning. Yeah, we should get that. In my gym, we just have someone with battle ropes. It would be way better just Amy.
I'm not intimidated at all.
Well,
okay.
But I love that they ask, did you remove your shoe? No, that's normally not something we do. Just to try to give an explanation why the shoe wasn't on his feet.
Right.
And did you see that video I played in the beginning from Court TV last night?
No.
It's a guy called Yellow Cottage Tail. Very, very sure that
Oh, you gotta show Val. You gotta show validity.
very guilty. Yeah. Jamie, I'm doing it now.
Hurry up, Baker. Oh.
Yeah, hurry up.
But he made a representation of what he believed happened that night, and Court TV showed this yesterday. It's very, very good.
We're gonna roll that right now and just describe what it's based upon, how you came to.
Yeah, so I'm sorry. Yeah, I struggled all summer trying to make sense, like all of us here, of the injuries combined, what we know about the injuries combined with the damage to the vehicle, right? So John is found 6 to 12 feet on the lawn. Next to him in the grass where there's no snow has accumulated, there are cocktail pieces. And we're told that the only injuries below his neck were possibly traumatic injury to the pancreas. We do also know he was knocked out of a shoe. And yet there was also damage to the car. There was DNA and a hair found on the car, and the taillight is cracked. So I really struggled to try to understand how a vehicle could make that head wound and not damage his torso.
And
so
not damage his torso. So
this is an attempt at that.
Right.
This is an attempt.
He left the drink in the street, which
yeah,
I get it. All right. I want to thank Rusty Hay, animation. We're gonna roll that right now and just.
Okay. The first problem that I have with that is that it was the wrong taillight.
Yeah.
It was the other side of the car, which would have put him on the opposite side of the street. So that stupid simulation is just ridiculous for that reason above more than any. Also, he wasn't found laying in the curb, right? They said he got launched 10 to 20 feet. You're not going to do that if you just get hit in the back of the head with a taillight. So if you
that will probably break your neck before it does anything else.
Right.
So I was saying, I was like, if his head got hit like that at 24 miles an hour.
Why doesn't counsel come to sidebar with the jurors are coming in?
Sidebar again.
Also, remember, the state said his head never hit the car. So that just negates that whole thing that he was knocked.
Yeah, it didn't
knocked by the car and then his head hit the ground.
A week ago, didn't Lally say that he never once claimed that the car actually struck John O'Keefe's head? Didn't he say that?
That's exactly what he said.
Oh, you guys are all ridiculous.
Thank you so much, Whiskey. And we'll get
that would have
right to
pulverized his head, like seriously pulverized his head.
Yeah,
it would have been like an overripe cantaloupe.
It would break his neck at least. So
he's just getting his drink out of the road. No big deal.
Yeah, and again, he uses the wrong car model. He uses the wrong side of the street.
He's an idiot.
And all these people who calls us grifters, you're grifting the other side, you idiot. And at least we try to make sense of it. You're just inventing stuff, trying to explain how it could have happened.
Also, why did he walk from the driveway all the way out to the street and across the yard to set his glass down?
To set his glass in the road.
Let me just wander down the street for about 5 minutes of walking in this blizzard, set my glass down so you can hit me in the back of the head. What a stupid person on Law and Crime, Court TV, whatever the hell it was.
That hair has been in evidence all along. They just found out that it's human hair, and the microcondic DNA is consistent with John O'Keefe, and that's very important. That his hair is on his girlfriend's car, because there's no way his hair could be there unless she struck him. Yeah, it's just stupid.
It's so dumb.
And I forgot to show the shoe falling off. Oh, and Bev is sighing hard.
She's always sighing hard.
Yeah, remember, the road is filled with ice, so it's just to cool his drink down.
Yeah.
And of course, you'd want the traveled on dirty snow. You wouldn't want that fresh snow up in the grass where you started when you got out of the car. You wouldn't want that.
I found the other shoe later in the day.
Thank you, Your Honor.
At the grass, on the grass.
Firefighter from Flamati, I want to draw your attention to the top video, and I may pause it and ask you a couple of questions. Let's go. Pause. Did you see a person run into the screen?
Yes.
Run into the frame rather from screen left?
Yes.
Who's that?
I don't recall.
Okay. Let's go ahead and play it. And pause. I want to draw your attention to the left side of the top video. Did you see somebody wearing a bright yellow jacket?
If you could rewind it, I'd look at that area.
Why don't I play it forward and see if you see that?
Yes.
Pause. And do you recognize that person?
I see a yellow jacket. I can't tell you who it is.
Okay. Based on your memory, have you seen this before, by the way?
No.
Based on your memory, is that the approximate position that Mr. O'Keefe was in when you or your colleagues made contact?
Approximately, I'd say a little bit more to the left. That would be my guess.
Okay. Go ahead and play. Pause it. You see the person enter from screen left into the frame.
It looks like a different person, yes.
That person right there. Looks like a long-haired female?
Yeah.
Does that appear to be my client?
From this angle, I couldn't tell you.
Okay. Go ahead and play it. Pause. You see a person wearing yellow right there on the left side of the screen.
If you're telling me that's a person, sure, yes.
No, he's not telling you. So ask the question.
What
If you
else
don't
should
see
it be,
don't
you
see
idiot?
If you do, you do.
Yellow jacket.
I can't tell what that shape is.
It's a bold
Can you
move.
take a look, keep your eyes focused on that and tell me if you see that figure doing anything?
Yeah, chest compressions.
Looks like he's giving CPR.
Do you recognize that figure now?
I can't recognize the figure, but it looks like an up and down rhythmic motion.
Okay.
That would indicate CPR.
Giggity.
Would that be you?
I couldn't tell you. Is the time accurate? There's 6:13.
I'm just asking you what you recognize on the video.
I couldn't tell you if that was myself or not.
Was there somebody else doing CPR?
Multiple people rotate through CPR, so yes.
Who's
In this
responsible for
incident?
doing the chest compressions?
Whoever's closest to that area, we're all trained for that skill.
Okay, I'm asking in this particular case.
Yes.
I know everybody's trained.
You testified you did it.
Earlier that you were the one doing the chest compressions.
I said I was one of them. Yes.
Nope. You
Does that
said
appear
you
to
were
be
the one.
doing the chest compressions.
It could be, I'm not sure.
Okay, let's go and play. Okay, stop.
Defense dementia.
Do you see the person basically in the middle of the screen there?
Yes,
Does that appear to be my client? Can you tell?
I can tell.
Go ahead and play it.
This is where she supposedly is over there talking to a not all, telling him, I hit him, I hit him, I hit him. And where the guy doing the chest compression is having a talk to her within 2 feet saying, hey, what happened?
Pause it. You see individuals entering from screen right.
Yes.
Who does that appear to be in the yellow jacket?
That build would have been probably, it could have been firefighter Kelly or it could have been McLaughlin.
And who's the person trailing the gurney? Right.
I can't tell.
Okay,
Oh, that no high res jacket. It's a man, it's not a girl.
Pause it. The person in the hood just obscured that figure. Did you see that figure standing on the other side of the person?
No.
Pause it. The activity that's going on just to the sort of left side of the SUV in the frame. Can you describe for the jurors what that activity is?
So that would be lowering the stretcher to get ready to load the patient on.
Okay. And now it's positive. Now, this person now appears to be facing the camera. Do you now recognize that person?
I don't.
Go ahead.
Everyone else can do that.
Right. He can assess who the paramedics are just by size and shape, but he can't do that for the women standing there.
Can you focus your attention on that individual in the yellow jacket?
Yes.
What is that
Doing
person's
chest
CPR?
compressions.
CPR.
Which part of the CPR?
Chest compressions.
Chest compressions.
Sorry, I didn't mean to talk over you.
It's okay. Chest compressions.
I want to make sure that Nancy can get down what we're both saying. So which part of the CPR?
Chest compressions.
Thank you. Is that you?
I don't know.
Okay. At this point, you have no idea whether or not you don't remember whether you were the one doing chest compressions when he was moved from the ground to the gurney?
I don't recall.
But you did earlier testify you were doing chest compressions.
I did at some point during this call, yes.
Okay. In the entire length of this video, did you see anybody else trade off from that person doing chest compressions from the time the person was on the ground to the gurney? Or is that the same person?
It could be the same person. I'm not sure.
Could be the same person.
Say that's probably good.
I
Checking
hate
on.
Sustained.
defense
Jurors
attention.
disregard that.
Why do these EMTs have such a desire for her to be guilty?
Because they want to be heroes. Now a lady is talking to her.
I want to direct your attention to this person. It appears to be a firefighter in the middle. Do you see that person?
Yes.
Who's that?
Objection, may we?
The objection sustained. I'll see counsel at sidebar.
Why? Why? He's asking him, do you see that person?
He didn't say who it was. He didn't say this is this person. He's not giving you facts that you now have to accept as true. He's asking and moving on when he doesn't get the perfect answer that he should be getting, or at least a good answer. And he's just moving on. He's not pushing the envelope anywhere.
But we now know he lied. And most likely so did not all, because she was never over there having eye contact with either of them. Both of them stated they have eye contact with her. And she told them, I hit him, I hit him, I hit him. That doesn't line up with the facts we've seen in the video. Yeah, she's really working overtime. Oh, by the way, I was supposed to read this out. Well, I'll pay double if you get her to sign it and send it to Grant. Eat Smith Grant. Love, Jamie.
The scratch and sniff poster.
Yeah. Well, the problem is no other police officer is in the courtroom. Normally, you will see a line of blue.
It speaks volumes that there isn't a bunch of police officers in there.
Yes.
Yes.
Take a look at the person or the yellow in the middle of the screen.
Oh,
Do you
he can't.
recognize
He's
that?
not allowed to say a person.
Has a fire jacket, and build, I would guess it was either firefighter Kelly or.
So we don't want you to guess.
My best estimation would be firefighter McLaughlin.
Firefighter McLaughlin?
Yes.
Okay, let's go to the play. Recognize the person in the yellow jacket to the right of who you just described as firefighter McLaughlin?
No.
What is that person doing apparently?
My guess would be, I'm sorry,
Not even an estimate. Do you know?
I don't know.
Next question.
Oh, she's still fighting to keep it out.
Yep.
There's never been a police presence, even with room in the courtroom.
At that point, did you join your colleagues in placing Mr. in the ambulance?
Yes.
Okay. Based on that, did that appear to be you following the gurney in the yellow jacket over to the ambulance?
Yes.
Okay. And who
Oh,
was
now he
the
knows.
lead firefighter? When I say lead, I mean the one to the right, leading the gurney on the front side of the gurney.
I'm not sure.
Okay. One of your colleagues, though.
Yes.
What did you do once you left the frame? Where did you go?
That would have been into the ambulance.
And as you earlier indicated, shut the doors, correct?
Correct.
Okay, and you never came back out?
No.
Okay. I'd like to draw your attention to the lower video.
Okay.
And we're just gonna let that play for a couple of minutes and see if you recognize anything. I'll ask you to pause it in just a second.
Why does she do that?
She's so annoying.
God.
And again, notice the sirens are not sirens. The lights are on, but again, no one wakes up inside the house.
I'm gonna ask you to look up to the top video. You see what appears to be a person wearing yellow to the right?
Yes.
But that's who that is.
No.
Go ahead.
Because there's at least 3 firefighters working on him inside the ambulance right now.
Yeah, they've moved him into the ambulance. They're working on getting him warm and the bone
Look at the lower
IV.
video. Do you see what appears to be a vehicle in the middle of the screen?
Yes.
What is that?
That is an ambulance.
Does that appear to be the ambulance that you arrived in?
Yes.
And that's the ambulance that you took Mr. O'Keefe to?
Yes.
Doors are closed?
Yes.
Are you in the ambulance at this point?
I'm not sure.
Well, this was, let me just ask it a different way. This was running continuously.
Yeah.
No pauses. You've already taken Mr. O'Keefe to the ambulance. Would you have gotten in the ambulance?
I don't recall.
You already said you were in there.
So
Yeah.
if you know the answer.
I don't know.
You said you
Next
were in there,
question.
bro.
I have no idea whether you're in the ambulance or not at this point.
At this point, no.
Would you have gone anyplace else? When you left the frame?
Could have been to gather equipment,
Did you go to White
but for
Castle?
certain, I don't know.
Where would Mr. O'Keefe have been?
Took a trip to Waffle House?
Been in the ambulance. Again, don't know for certain.
Could have been or was in the ambulance?
At this time, I don't know.
Okay. Let's go to the
So what?
He's being intentionally deceitful.
Stop. Okay. Taking a look at both screens, you see the group of people, including the individual with the yellow jacket at the bottom screen,
Yes.
that appear to be the same from a different angle, same group of people, including the person with the yellow jacket on the top screen.
Yes.
Who was the person that was directed to get the medical history from my client?
McLaughlin.
You believe that's Miss McLaughlin?
No.
You don't think that's her?
The giant man.
I'd have to
standing next
rewind
the
to know
two
where
women.
she went.
Well, let me ask you a couple of other questions. In the bottom screen, you see a police officer?
Yes.
You see a woman with long hair standing next to the police officer? That appeared to be my client?
Yes.
The
There we
individual with the fire jacket on, right?
Yes.
And she was, Miss McLaughlin was directed to get medical history and interview my client, correct?
Yes.
Does that appear to be what she's doing right there?
Objection, Your Honor.
Sustained.
Why?
Why?
At this point, where do you believe you were now?
We're not in church. He doesn't believe.
I don't remember.
Think you
Don't
might have been in the
remember.
ambulance?
I don't remember.
You testified earlier, and this has been a continuously running video on the
Oh,
top.
Alan Jackson.
Testified earlier that when you left the screen with that gurney, you got in the ambulance, correct?
We headed that way, yes.
So firefighter.
No, you
Hamadi,
testified. You went in
not
there
your
and closed the
question.
door.
Where did you go when you left the screen?
Did you take a
It would
detour?
have been to either gather equipment or to put the patient in the ambulance.
Okay, when did what equipment did you need to gather?
It would have been anything that was left by the patient's side, whether it was a first-in bag, airway bag, any other equipment, basically.
You were doing chest compressions.
I didn't state that.
You didn't say that?
You
I
just
said I did chest compressions at some point. I didn't say I did them continuously throughout the
Oh
call.
my freaking
So
god!
you
This
just
is a
put John O'Keefe in the back of the ambulance and went to look for some equipment?
Not what I said. So chest compressions were done continually throughout, whether they were done by me or by another provider, I can't tell you specifically.
So when you left the screen and John O'Keefe is on the gurney, you're engaged in vital, life-saving, a vital life-saving endeavor, correct?
Yes,
That had to have been your focus, correct?
that was at the time, yes.
And you wanted to get him out of the cold, the weather,
Yes,
because it was inclement, it was freezing out, correct?
yes,
So you wanted to put him in the ambulance, right? And you wanted to continue CPR because in your words, you testified on direct examination, you believed that there might be some viability left.
yes,
So CPR and life-saving measures were absolutely vital at that point.
yes.
Never
You
trust
didn't go find equipment, you got in the ambulance, didn't you?
Yes,
So at this point, you're in the ambulance, correct?
at this point, I don't know.
You indicated you never got back out of the ambulance after you got in, correct?
I don't believe so, no.
You did say that. Keep in mind, you guys, this is a agent of the state that has nothing to do with the criminal aspect of this case. He's
Did
being
you
this
see any place in that
deceitful, this
where you had any sort of detailed conversation
evasive
with my client?
over how he gave medical care.
Any place in that video where you engaged my client and said, how'd you get here? What happened? And she said, I hit him. And you said, how'd you hit him? All the stuff that you testified earlier to.
I didn't see that in the video, no.
You indicated in a police report during an interview that you had with
Proctor. Thank you, Whiskey, so much for the $10 call.
Yuri Butnik on February 8th.
And I will try to get a mic that can translate mouse mouth.
That my client said, I hit him. Correct?
Correct.
You remember having that conversation with Sergeant Butnik?
I don't recall the conversation, but I'm trusting that your records are accurate.
Is it true that during that conversation, you indicated to Sergeant Butnik that, quote, Katie spoke with Karen Reed. Katie is Katie who?
McLaughlin.
Katie spoke with Karen Reed, collecting medical history for the victim, and was also told by Karen that the last time she saw the victim was 1 a.m. that morning. That is when Anthony, who's Anthony?
Would have been myself.
That is when Anthony heard Karen say, I hit him, I hit him.
And go back and watch his testimony to the state. He said, I got into the back of the ambulance. It's a two compartment. At some point, the female officer got in and drive. So again, he did state that. Just because he can't remember now when it's a bit critical, he again lied. He did state that on direct, that he got in the back of the ambulance and started doing all of this. He read his report about everything he did to the body. He never stated, I got back out, grabbed the back of anything. He was in the back of the ambulance from the second he got into it till the hospital. Just so no one reads that comment and think, yeah, maybe he did. No, he stated clearly, I got in the back of the ambulance, started doing this and that and giving him all kinds of things, put warm water into his bones, gave him epinephrine. So just to put it down so no one believes that he didn't state that.
Is that what you told Sergeant Butnik?
I don't recall.
Does it appear that this is the time, firefighter Flamani, that Katie McLaughlin is getting a medical history from my client, or attempting to?
I can't tell from the video, no.
You do know, however, that during this time, you're in an ambulance, probably 30 or 40 feet away, with the doors closed.
I don't know.
Well, you certainly don't see yourself in that frame, do you?
Doesn't appear to be, no.
Just say no, you idiot. I just hope this female officer isn't as corrupt as these two.
If we're done with the videos, can we take it down, please?
Of course. Yes, I think we are finished. Thank you, Your Honor. You were the lead firefighter on that team that night, correct?
Lead paramedic.
Lead paramedic, thank you. You understood, obviously, the gravity of hearing a statement like, I hit him, some sort of an explanation about what may have happened to the victim, correct?
Correct.
That statement could potentially have direct relationship to, or a direct relational impact on how life-saving measures are done by the medical personnel that you turn the victim over to.
Correct.
You testified at the grand jury that you wanted, once you got to the hospital, you wanted to be as quote unquote helpful as possible when you handed over the patient, correct?
Correct.
You said you actually stayed at Good Samaritan for an additional 10 to 20 minutes, which is your habit in cases like this, because you wanted to be quote unquote an asset to the medical intervention team, correct?
Correct.
That team includes the doctors and nurses that were trying to provide life-saving services to Mr. Oak.
Correct.
But you never relayed to a single doctor or a single nurse a single word about a woman who said, I hit him, did you?
So documentation for us ends at transfer of patient care. As far as my memory, I do remember relaying that information to the doctors and nurses.
You do?
Yes.
Have you ever testified about that ever previous to this?
Never been asked about that.
Oh, nobody ever asked you, so you didn't tell anybody?
In the court setting? No.
Testified in front of a grand jury, didn't you?
Yes.
Shalali asked you a bunch of questions. Yes. During the course of that conversation that was under oath, did you ever disclose that you told the doctors and the nurses that you heard a woman say, I hit him?
I recall telling the doctors and nurses that there's a question of that the patient was hit by a vehicle or we don't know, is what I directly said to the doctors and nurses.
You directly told the doctors and nurses that there was a question about whether or not he was hit by a vehicle, right?
Yes.
Have you ever said that in any context, either to the police or in a grand jury before today?
I don't recall.
You were asked a bunch of questions yesterday, the day before yesterday, and this morning by Mr. Lally.
Yes.
This man isn't.
Did you say it on your direct examination?
I wasn't asked that question.
So since Mr. Lally didn't ask you, you just left it out that you told the doctors, the medical professionals, that in fact, you described that this patient was likely hit by a car.
Objection, Your Honor.
Sustained.
You wrote a report as well, correct?
Yes.
We've talked a little bit about that report. There's an area in the report for a narrative.
Yes.
About your observations, your experiences with this patient, correct?
Correct.
Your job as a lead paramedic is to be as detailed as possible, correct?
Correct.
You want to provide and impart the most detail you possibly can about an incident to assist in medical intervention, correct?
Correct.
Take a look at page 3 of 5 of your report.
Yes.
You see that narrative area?
I do.
Can you point to that portion of your report where you indicate that my client said the words, I hit him?
It doesn't say that.
Can you point to your report, the portion of your report where you indicate that you told the doctors and nurses that she said, I hit him?
Doesn't say that.
Can you point to that portion of your report where you indicate that your concern for the patient was that he had been hit by a car?
Doesn't say that.
Oh, weird. Regardless of
You indicated on direct examination
Karen Reed
that
actually
you were quote
stating
unquote
that?
looking for anything that we could pass on to the emergency room that would assist.
Yeah.
And you failed to mention that
I think it might have been an assistance to the emergency room personnel to indicate that you believe this person had been hit by a car.
Objection.
Sustained.
Do
Why?
you believe that that would have been an important piece of information to pass on to the emergency room assistants?
Objection.
I'll let him have that.
Thanks. It would have been important, yes.
And it's
Then why
nowhere
didn't you give
in
it?
your reports, correct?
It's not in the reports, no.
You didn't tell that to the police when you were interviewed 8 days later.
I was not asked about how or what I was.
My question is, did you tell the police 8 days later, or 9 days later when you were interviewed? And you didn't tell the grand jury that, correct?
No.
And you didn't mention that on direct examination in front of these jurors, did you?
No.
Wow.
Have a moment, Ron.
Yes.
That's all I have, no, thank you.
Hey, Mr. Lally.
Look how ready he is.
I know.
So Firefighter Money, you have been asked some questions about the observation you made of Mr. O'Keefe's abdomen being distended. And absent any external observation of injuries, that could be from an internal injury cause, is that correct?
Correct.
Now, the conversation that you were talking about in which the defendant indicated to you repeatedly that she hit him, or I hit him, that occurred on your sort of way to the body, correct?
Correct.
Now, turning back to sort of when you're coming to the scene and arriving at the scene, you've got a call or dispatch in regard to an unresponsive male in the snow, correct? Correct. You know that going, correct?
Correct.
And where you sort of bring the ambulance to a stop, there are other vehicles already in that area where Mr. O'Keefe is, correct?
Correct.
And it's from that vantage point that you're able to then see Mr. O'Keefe's body off the side of the road about 10 feet or so into the lawn.
Correct.
Now, when it comes to chest compressions, your department, any department, as far as sort of the medical field,
He's focused on
is there
such
any
the
sort of policy
stupidest
or
stuff.
protocol for how long
He's an
one
idiot.
person should be doing those at a
Again,
time?
I'm just
So,
stacking a lot of.
Recommendation is always 2 minutes,
Oh.
but it's usually based on the fatigue of the provider. But really, the most important thing is just quality of CPR and making sure that they have the best CPR throughout, regardless of fatigue.
So it's not recommended that one person do continuous chest compressions for 15 or 20 minutes.
Doesn't
correct?
matter.
It's actually recommended
He
not.
didn't talk to her on the
And so
video.
that would be sort of, when you have that many sort of assets within one scene, would it be typical for somebody to continue on with chest compressions for that long period of time? Those videos that you were showing up on the screen, have you ever seen either of those videos?
No.
So you have no idea.
That's
as
why
far
he
as
made his
times,
story
whether
up.
they're
I didn't
accurate,
know
correct?
who would be caught in it.
And whether the videos are synchronous, you have no idea about that either, correct?
No.
The conversation in which you heard the defendant say, "I hit him," and the conversation that Firefighter McLaughlin had, in which the defendant told her, "I hit him," those are two separate conversations, correct?
Correct.
Happened at two different times, two different locations, and you weren't even present, Mr. McLaughlin. Correct? And you did, when you were interviewed by the trooper and when you testified before the grand jury, you indicated in both instances that the defendant said to you, "I hit him," repeatedly, correct?
Correct.
Now, when
But
you were
you didn't
asked
tell
questions,
anyone.
About what you relayed to the hospital staff, that
Well, it wasn't
what
important
you're
at the
testifying
time.
to, that your memory. of
Here's
what
how you know it's
correct?
bullshit, because
You
he
indicated in that
continues
that you had said something,
to I refer to John O'Keefe as a body in the snow, not a vehicle pedestrian victim, right? It's not the guy that got hit by a car they found in the snow. It's a guy they found in the snow. If it was a guy that he believes got hit by a car, he would have been saying that from day one. It was a vehicular strike and he was found in the snow, barely conscious, right? That's just the way it would come out. He wouldn't say it any other way. It wouldn't be a cold victim. It wouldn't be it's just dumb. It's dumb. This guy is dumb. Oh.
She has a dictaphone, so she's stating, so they don't write down the testimony. She's speaking into the microphone. But I can assure you, because when I was on my bio break, I just checked up on Lorne and Krim. They are believing that this is the important part, testifying that they did CPR, because that's very, very important. So you can trust him when she said something to him without being near her.
Yeah.
Question
Okay.
about whether or not Mr. O'Keefe had been hit by a car, correct? And so from your conversations with the defendants and the sort of expounding questions that you would ask for clarification, Why was it that you related motor vehicle sort of specifically as a question to the hospital staff?
So it was due to the proximity of the patient to the roadway and the vagueness of the statement. So proximity to the roadway and the fact that she stated, I hit him, the red flag of him being underdressed and not, people don't just lie down in the snow in a blizzard. So how he got there, we're not sure. So we're trying to figure out what happened, but due to the proximity of the
They
roadway,
do
that
if
was our
they're
first
underdressed
inclination.
and get hypothermia, you idiot.
Well, your
All right,
buddy
you-
said that he was dressed for the
Couple
weather,
questions.
so you guys need to get your shit together.
You indicated that it's not recommended that someone do chest compressions for 15 or 20 minutes.
Correct.
You saw the video.
Correct.
That video was about 3 minutes.
Yes.
Did it appear that the same person that was doing chest compressions at the beginning of the video continued doing chest compressions all the way through?
I don't know.
We just watched the video.
I can't tell you for certain which personnel. We all have yellow coats, so I can't tell you if somebody swapped. I don't know.
Did it appear to you in watching that video that the person that started on the chest compressions on the left side of the screen continued all the way through, up to the scoop, up to the gurney, and off screen doing chest compressions?
Objection.
Sustained.
Thank you, Zach, for being a member for 4 months. Say something for free. This is so
You
stupid.
indicated that when you heard this phrase, I hit him, that your response was, did you hit him with your hand, right?
Yes.
Did you kick him?
Yes.
Did you punch him?
Yes.
That's what you previously testified to, correct?
Yes.
Nowhere in that conversation, did you ever suggest, did you hit him with your car?
I don't recall if I asked her specifically about that.
So now you don't recall about that either.
Objection, Your Honor.
Sustained.
Why?
And for the first time in any forum, you're telling this jury that you then thought, based on that conversation that was attendant to the video that we just watched, you believed that Mr. O'Keefe had been hit by a car and that she said she did it.
I did not say that. So what, am I allowed to respond?
Yes.
You
So
just did.
I left it open-ended to the staff of the hospital that these are both possibilities of what happened to the patient.
And of course, if you had said that to the staff of the hospital, the staff of the hospital would certainly put it in some of the medical reports, correct?
They don't have to. It's really up to them.
And you're aware that none of those have that statement.
I'm not aware.
All set? All right, you are all set, firefighter Flamati, or paramedic Flamati. Thank you.
F out of here.
Who is your next witness, Mr. Lally?
Yes, Your Honor, the call multiple call, Mr. Matthew Kelly.
Okay.
You know, may I approach just to retrieve the exhibit?
Sure.
I think is over there.
And now we're going to do another EMT guy, and that's going to take the rest of the day, and nothing will be learned other than he also made up his story.
Well,
Oh, is it police
hear
officer?
about his life history and education.
I do.
Morning. So you can sit or stand, however you're comfortable. Just bring. Perfect. Thank you. All right, Mr. Lally, whenever you're ready.
Good morning, sir.
Good morning.
Could you please state your name and spell your last name for the record?
Sure. Matthew Kelly, Kelly.
And what is it that you do for work, sir?
I'm a firefighter paramedic for Canton Fire.
And how long have you been a firefighter paramedic with Canton Fire?
Approximately 2.5 years.
And prior to working for the Canton Fire Department, what, if any, other employment did you have within that sort of field?
I worked for a private ambulance, first ambulance service for approximately 5 months.
And sort of geographically, where was that located?
Boston area.
Now, prior to you working as an EMT or a paramedic, you worked as an EMT before working as a paramedic?
Correct.
Okay. And so prior to working as either an EMT or a paramedic, did you have any sort of training or did you receive any sort of certification in regard to being an EMT paramedic?
Yeah, so I had to do a 6-month EMT course, and then I had to do a practical and written exam for the course, and then for the state to get my EMT. And then for a paramedic school, it was about a 10 to 12 month didactic portion. And then I did I believe it was 200 hours clinical in the hospitals. And then I did 300 hours ride time. And then I had to do a practical and written exam for the course and also for the state.
You got 3 words too. Thank you for being a member for 5 months, C-Swept. I'm not sure that there was snow at the scene. Hopefully we'll get into it with this witness because I'm a little unsure if there was any snow that night. Jeepers cripes. And now we're going to go through a half an hour about nothing again. Jimmy,
Yeah, 'cause
can
it's
you
all
just yell really loudly? I'll take a nap.
No.
And now
I'm
with
just
Canton
gonna-
Fire, I'm getting precepted as a
I'll
paramedic.
be back.
And when you use that term as far as precepted, what exactly does that term mean within your?
It just means that you get trained by an experienced paramedic for an extended period of time until they say that you can do the job on your own.
And with regard to being a
Thank you, Haley, for
EMT and
4 months.
paramedic, you receive certification in regard to working within that field?
Do you say that again?
With regard to being an EMT and a paramedic, you receive some sort of certification either from the state or some other body in regard to working in that field?
Yes.
You have certification in regard to both?
Yes.
And is that certification up to date?
Yes, it is.
Sir, if I could turn your attention to January 28th, the evening of that into January 29th, 2022. Were you working with Canton Fire Department that day?
Yes, I was.
Recall what kind of shift you were working on that day?
24-hour shift on the ambulance.
And which station house were you assigned to on that?
Station 1.
And that's located where within the town of Canton?
99 Revere Street.
And you were assigned to the ambulance, is that correct?
Correct.
And who, if anyone else in your department, was assigned to the ambulance along with you?
Paramedic Anthony Fulmati.
And
Yeah, I
on
should
that
do
morning
that.
of January 29th, do you recall about what time that you woke up on that day?
I believe it was about 4:45 a.m.
When you woke up, what, if anything, is it that you did with regard to your duties and responsibilities around fire station house one?
So we woke up a little bit early to shovel off the apron,
Thank you,
shovel off
Haley.
the parking lot, and just prepare for the new shift coming in.
Oh, it sounds like there's.
And just briefly, sir, like, so when you go outside to shovel, what, if anything, do you recall about sort of the weather conditions and what they were at that point?
There was snow on the ground. It was snowing, high winds, low visibility, still dark out.
Thank you.
Do you recall being dispatched to a call shortly after 6 a.m.?
Yes, I do.
And what was that call, or what was that dispatch in regard to, and where specifically were you dispatched?
It was unresponsive male in the snow on Fairview Road.
And that area of Fairview Road, through your work with Canton Fire Department, are you familiar with that specific area?
Yes.
And you respond in the ambulance, is that correct?
Correct.
Who, if anyone, goes along in the ambulance with you?
Fulmati was in the passenger seat, and then paramedic Tim Nuttall was in the back.
Who was driving?
I was driving.
And in addition to the ambulance, ambulance one that you were in, what, if any, other sort of vehicles or apparatus responded from your station to Fairview Road?
We also had an engine and our shift commander SUV.
If you recall, who was the shift commander in the SUV?
Shift commander was Captain Wendell Robery at the time.
And Captain
We have learned that there was snow, and everyone had talked to Karen Reed, even though the video showed none of them talked to her.
Robery is now the chief of the Canton Fire, is that correct?
Correct.
And as far as the engine was concerned, who, if anyone, was assigned to the engine and responded to the call as well?
It was Lieutenant Greg Woodbury, firefighter paramedic Katie McLaughlin, and firefighter paramedic Frank Walsh.
And as you're driving from the station house to Fairview, what, if anything, you recall about weather conditions, visibility, anything like that along the way?
Just heavy snow and wind, real low visibility. Good amount of snow on the ground, so I was just trying to take it slow so we didn't spin out or drift or anything like that.
And can you describe for the jury sort of the route that you took from the station on Revere Street to Fairview Road that morning?
Yep, we took a right onto Revere Street, left onto Sherman Street, right onto Chapman Street, and then a left onto Fairview.
And as you're driving down Fairview, what, if anything, can you tell the jury about sort of the elevation of that roadway as you go from Chapman down to where you stopped?
It was a pretty steep, long road downhill. It was probably downhill for half of the way through Fairview. And because of that, I was just trying to go real slow, so we didn't drift down that hill.
You
One last
Massachusetts
question about
really
driving,
should
as
learn
you're
how to
driving
drive.
along, what, if anything else, did you observe as far as sort of other vehicular traffic on the roadway, any other cars, trucks, anything like that?
Nothing until I saw the police cruiser at the scene.
And so as you're approaching the scene and you're driving towards it, what, if anything, sort of first draws your attention to where you're going and where you stop?
So it was just real low visibility, but we could see blue lights at times. So just kept going towards the blue lights and knew that it would be in that area.
Now, where do you stop in relation to the cruiser?
I believe they were facing towards us, so we would be in front of them.
And at some point, you're being dispatched for an unresponsive male part, correct?
Yeah, they're
So when
talking
you're
about
pulling up to the
snow
scene
like
to
they
see
live
the
by
cruiser,
me.
Are you able to also see any sort of unresponsive male
Like
part?
here, when it snows,
Not
everything
when I'm
shuts
in the
down.
truck.
I can't imagine that it's that way in Massachusetts, right?
I'm
They get
believing
snow all the time.
Massachusetts is down by the Gulf of Mexico, right? Where there's never snow.
Apparently.
I thought I could understand it's not like Canada, but still, they got a heck of a lot of snow up there.
It's
And
pretty
everyone
close to Canada.
Yeah, but we've seen the videos. This is fun driving weather. Just don't get too close to houses. You can do a lot of fun stuff. Jesus, effing.
I had to get out of the truck to see.
And when was it, and how far away from it were you at the first time that you observed the unresponsive man?
Once I got out of the truck, I was probably had to be about like 5 feet away until I could see the victim.
And at this time,
The other
when
guy
you're
who was
arriving
sitting next to him
sometime
could see him
shortly after 6 a.m., light out,
from the
dark out,
ambulance.
It's dark.
And just so we can stop saying unresponsive male, at some point you identified who the patient was that you eventually treated and transported. And who did you identify?
Mr. O'Keefe.
John O'Keefe, is that correct?
Correct.
Unresponsive
so you get out of
male,
the vehicle,
not vehicular victim.
You all get out at the same time, is that correct?
Relatively, yeah.
And
That
where is it
is a
that
bit
you,
better.
firefighter Famadi and firefighter Nuttall, go?
So we first go to pick up some of the bags and stuff that we would need to conduct a arrest, and then we just go straight over to the body and some people that were out there.
And with regard to the bags that you retrieved, what kind of bags are we talking?
We take like a first in bag that has miscellaneous stuff. We'd take an airway bag, and we would take a cardiac monitor.
And when you indicate, as far as where Mr. O'Keefe was, who, if anyone else, or what, if any other people were in that same area?
Can you say that one more time?
When you first go over to where Mr. O'Keefe is, who, if anyone, or how many other people are in that general area?
Sure. I remember seeing a police officer and 2 women.
And as far as where Mr. O'Keefe was, first of all, how was he positioned in relation to the ground?
He was on his back, probably about around a fire hydrant, probably about 5 or so feet from what I saw would be the street.
So you believe about 5 or so feet in from the road, correct?
Correct.
The other two said
Now,
10.
with regard to
one of them said 20.
Mr. O'Keefe, when you first come over,
Yeah, that's the
what, if
that's
anything,
the
did you
police officer.
observe as far as snow on him or around him or in the area where?
I don't really recall.
Do you recall how Mr. O'Keefe was dressed when you first got over there?
I believe he was wearing a hoodie, like a sweatshirt and jeans, and remember he had one shoe on, but forget which shoe it was.
I don't recall which shoe it was, but if there was one shoe on his foot at that point.
Correct.
And when you first arrive at this patient, at Mr. O'Keefe, what is it that you and the other firefighters are doing in regard to treatment?
So the other firefighters were checking for a pulse. And then after that, while I was getting some of the supplies, and then we would start compressions and start moving them into the ambulance so we could get a better look at them and what we were doing.
When you say start compressions, what kind of compressions are you referring to?
CPR.
Chest compressions,
Yes.
different. And based on your training experience, is there some sort of protocol as to how long one individual should be doing chest compressions?
So we want early and continuous chest compressions for as long as the person is pulseless. We will take breaks in order to check for a pulse and check for any rhythm changes.
And so when breaks are taken, is that one person that's doing those same compressions the entire time, or is it switched off or something else?
We try to switch off every few minutes.
Now, when you first approach where Mr. O'Keefe is on the ground, what, if any, sort of injuries, if at all, did you observe on Mr. O'Keefe at that time?
On the ground, I didn't observe any injuries or recall seeing any injuries at the time. It wasn't until got him in the ambulance that I saw some injuries.
That's funny.
And so from that sort of initial assessment and initial sort of treatment of the patients, what exactly does that sort of assessment and treatment consist of when Mr. O'Keefe is on the ground?
Basically just checking for breathing and if he has a pulse. It was pretty dark and very low visibility, so we wanted to get him out of the conditions and into the ambulance to kind of further assess him.
And from your sort of initial assessment, did he have a pulse and was he breathing?
No.
And so want to get him out of the conditions, and how was that accomplished?
I believe we used a scoop board or scoop stretcher. It's just a backboard that breaks into two pieces that you can slide underneath the victim or the patient. We used that, and then we had picked him up and put him onto our actual EMS stretcher, and then just put the stretcher into the ambulance.
And where was the stretcher sort of placed in regard to where, or in relation to where Mr. O'Keefe was 5 feet off the road?
I don't recall.
Now, once you get to the ambulance, what, if any, difference did you notice between sort of the lighting in the ambulance versus the lighting outside on the lawn?
So there was very low visibility outside. There was great visibility inside with lighting all around the back of the ambulance.
There was a cruiser lighting
And
up
so
the
once
area,
you're in the back
you
of the
idiot.
ambulance, what, if anything, did you observe or know at that point in regard to any injuries you observed?
There's enough light for them to find a clear glass in the snow.
Like a swollen black and blue right eye, and he had some blood around his mouth.
He had 2 black eyes.
Now, as far as Mr. O'Keefe was concerned, during treatment, you're touching
We
or
don't
making
know.
contact with Mr. O'Keefe's body, correct?
Correct.
And during the course of that, what, if any, observations or what, if anything, do you know in regard to sort of tactile observations of Mr. O'Keefe?
He was very cold to touch, very stiff, almost frozen-like. Yes.
Now, at some point during the course of your treatment in the back of the ambulance, are his clothes removed?
Yes.
Is that, why is that?
It's just so we can try to examine his full body for any other injuries.
And there's some concern for cardiac arrest, correct?
Correct.
Can you explain, are you familiar with that term?
Yes.
Can you
Why?
explain to the jury what your understanding based on your training experience is as what is cardiac arrest?
Sure. It would be when a person has a lethal cardiac rhythm where they no longer have a pulse.
Now, once the clothes, as far as being removed, how are they physically, sort of, how are they removed?
I believe they were probably cut off
If he
with
doesn't
trauma
stop
shears.
doing that lip smack thing before he answers.
Once the clothes are removed with trauma shears, what, if any, additional observations did you make of injuries to Mr. O'Keefe's body?
There was some lacerations on his right upper extremity.
Lacerations. Blunt force lacerations.
Blunt force lacerations.
And no EMTs have mentioned the 6 centimeter long gash in the back of his head.
Now, the chest
think as an
compressions
EMT that'd
that
be
you were
important.
talking about, was that continuous sort of throughout the patient care with respect to Mr. O'Keefe?
Hi, Josie.
And in addition to that, what, if anything, was done with respect to body temperature
Hey,
for
Helena.
Mr. O'Keefe once in the back of the ambulance?
So we did some rewarming. So we did heat blankets and warm fluids.
And as the chest compressions continue in the back of the ambulance, what,
So
if anything,
much.
did
Josie.
you
Hate it so
observe
much.
with regard to Mr. O'Keefe's nose or mouth?
I remember that there was some blood or vomit or bile coming out of his mouth.
Now, turning your attention to back outside of the ambulance, taking you back there for a moment. You indicated in your testimony that when you arrived there were 2 females in the area where Mr. O'Keefe was. Is that correct?
Correct.
Can you describe anything as far as what they look like or anything about those 2 females that you saw?
I just remember they were white, looked to be between 35 and 45 years old, I would say.
Nick, watch 10 minutes of this and you will hear more what, if any, than you did in the entire 8, 12 weeks, however long that case was. He uses it in every sentence as a get-all because the judge is really fond of the state, not that much of the defense. As long as he just says that, he can do all the leading questions he wants and do whatever the defense isn't allowed to do. Yeah, I find it weird that he had stuff coming out of his mouth because the first thing you do is put your finger down before you start CPR and make sure the airways are cleared. Well, I was taught that when I did CPR.
And average build and height.
what, if any, sort of distinguishing characteristics did you observe between one of the other?
I remember one had some red stuff around her mouth. I was thinking it could be blood.
What else could
And
it be?
that individual that you observed with red stuff that you thought could be blood around her mouth.
She smeared her lipstick.
What, if
That
any,
was all.
observations did you make of her as far as her demeanor or anything like that?
She was just acting kind of erratic and kind of running around screaming different things.
And as far as the different things that she was screaming, what, if anything, do you recall
I hit him,
specifically
I hit him,
hearing
I
her
hit him.
screaming when she was running around?
It was just something like, he's dead, he's fucking dead.
Oh,
that's a new statement.
Okay.
Is that something that she said once or more than once or something?
At least twice.
As far as that sort of phraseology, was that consistent throughout?
I would say so, yes.
Pretty close.
yeah. But Nick, don't watch the video because
Now,
they can't remember
When
being
you
there.
enter the ambulance, does the patient care continue, obviously, with Mr. O'Keefe?
Hello.
Yes.
And if you recall, who was sort of involved in that patient care in the back of the ambulance?
Me, Nuttall, Flamati, Woodbury, Walsh, and McLaughlin came in a little bit later. I'm not sure if she did any patient care or not.
Did Famadi
So the
leave
majority
the
of the people
ambulance?
from the department that responded to the scene at one point or another were involved in patient care with regard to Mr. O'Keefe.
Correct.
Now, you drove the ambulance to Fairview, is that correct?
Correct.
And so for the transport.
I remember
from,
everything at the grand jury.
Fairview, what hospital did you go to?
Good Samaritan.
So for the transport from Fairview to Good Samaritan, who drove the ambulance then?
McLaughlin.
And so firefighter McLaughlin's driving, where are you located within the ambulance?
I was in the back with Nuttall and Flamati.
Do you recall sort of specifically what, if anything, you were doing with regard to patient care during the transport phase?
So
I was just helping them. Transport phase. I was doing compressions before, but we had switched them over to a automatic compression device. So I was just involved in helping ventilate and suction.
And was there who, if anyone else in the back of the ambulance was also sort of working on the airway portion?
We've Nuttall, and I forget who else.
Now, during the course of transport from the scene when you arrived to Good Samaritan, what, if any, change did you note in reference to Mr. O'Keefe as far as heart activity, respiratory,
really?
anything of like?
I don't know.
No changes.
For real, not like Valhalla. Happy birthday, Nick, if it's really your birthday.
Yeah.
25.
If he's not lying, happy birthday.
Firefighter Kelly, I'm just directing your attention to the screen and what's been marked as exhibit number 9. Do you
Damn it,
recognize
David.
that?
Yes.
And what do you recognize that?
The location of the scene.
Nope. He said
No.
he's dead. He's effing dead.
Correct.
And Ms. Gilman, if I could also have exhibit number 18.
Hey, Ralphie.
Thanks, Rosman.
Hi, Ralphie.
Thanks,
Again,
Mark.
sir, just directing your
Thanks,
attention to
Nick.
the screen. You
Appreciate
recognize
it,
the
y'all.
photograph that's up on the screen.
Yes.
What's depicted in that photograph?
The location of the scene again.
Sort of a different view of the same home, is that correct?
Correct.
May I approach the witness, John?
Yes.
What is that flag?
Someone's got a Marine flag.
Okay.
As Navy guys, we wouldn't know.
Doesn't look like a Marine flag, but
Firefighter Kelly, with using that.
Actually, I was asking if it could be something to do with a police.
that'd be
thing.
my guess.
Yeah, because I never seen red and yellow as military emblems from the U.S.
I think I think field artillery might have like that yellow and red or whatever the hell it is.
Marine flag is red. Well, Valhalla claims he's a Marine, so he should know.
I am not a Marine. I'm a fake Navy guy. Oh, yeah. I guess the Marine flag is red as hell.
I'm a fake Navy guy.
Yeah, I don't believe that you just start pumping his chest because you need air in the system to pump around. So that's a bit important.
Yeah, that's probably it.
It could be. Yeah, maybe.
That looks like it.
Kinda.
Laser pointer that you have now before you, if you could, please direct the jury's attention on the screen to whereabouts you located Mr. O'Keefe in that supine position when you first arrived.
It's about this area right here.
Where?
Thank you. I have nothing further to this witness.
All right, cross-examination.
Yes, may we approach for a minute?
Okay. Jurors, remember, you can stand up and stretch anytime you go to someone.
Thank you so much, Jeff. Grant is stretching. Doink the clown is stretching.
Jesus!
Doink is stretching. You saw it, people. Doink the clown is in the courtroom. Doink, 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 doink.
Doink, doink.
David tried to drag me into a Twitter argument with him the other day. And now I'm getting tagged with all this stupidness that I have nothing to do with. Thanks, Dave. Appreciate it.
Oh my god. Oh, I seen him post something that was so ridiculous.
Good morning, sir. Mr. Kelly, you and I have never met before, correct?
Correct.
We've never had a conversation?
Correct.
In or out of court?
Correct.
Doink is Grant Smith Ellis. He's a citizen journalist who is, I would say his IQ level is less than his shoe size. And he blocked me on Twitter. I still offer him $20 if he'll unblock me.
Now, with regard to the clothing that John O'Keefe was wearing when you came upon him, I believe you remembered that he had on a pair of jeans.
To the best of my recollection, yes.
And you remember
No one is
that he
questioning
had
that.
a hoodie
Paramedics
sweatshirt?
have absolutely nothing to do with
And what
how
also
you
stuck out in your mind is
unalived.
that he had only one shoe on, correct?
Correct.
From your memory, you're not sure if it was the left or the right shoe, but it was one of those, correct?
Correct.
And you did not see another shoe or the matching shoe in the area anywhere around where he was lying, correct?
Correct.
And to your memory, you never saw that other shoe, correct?
Correct.
Now, with regard to the removal of the clothing, I believe you testified before this jury on direct examination that trauma shears would have been used. Is that accurate?
Yes.
And what do those look like? How big are they? And if you could describe them.
They're about this big, so say 6 inches, and they have usually like a plastic or metal handle, and then just kind of 2 curved blades that are used to cut.
And are they essentially a large pair of scissors?
Yes.
And are they sharp in terms of the blades?
Yes.
And they need to be somewhat, heavy duty because you don't know
Why are we talking
what type
about
of clothing you're going to have to cut,
scissors?
correct?
Correct.
Who's probably going to make
Where
sure.
was it
about
that the trauma shears were used in order to start to remove John O'Keefe's clothing that morning?
I don't recall.
Do you recall if it was before he was put into the ambulance, during the ambulance ride, or after he was at the hospital?
I believe it would, I don't recall, but I believe it would be in the ambulance.
I'm sorry, there's a little bit of noise. Could you repeat that?
Sure. I don't recall, but I believe it would be in the ambulance.
In the ambulance. And you wouldn't have waited
Oh.
until you got to the hospital because
That's because
there
Noddle
was
said
a
they did it
reason
on the
why you
ground.
were taking the clothes off, correct?
Correct.
And what was that reason?
To look for any other injuries that the patient might have.
And that was a priority as you were treating, correct?
Correct.
You don't think that you cut off his clothes before you put him in the ambulance, correct?
Correct.
And you don't think that, and when I say you, I mean your team.
Right.
You don't think your team cut off the clothes after he was out of the ambulance, correct?
Correct.
So it was sometime during the ride.
Correct.
Do you recall who it was that actually used the trauma shears along?
No, because trauma shears has a rounded edge, exactly so they don't stab people when they cut through stuff. It's the same if you are I think if you have a escape knife from your parachute, if you're airborne, you have a flat tipped knife.
The hook.
Yeah, because back when they just had the K-bar, you had guys stabbing themselves a lot of times trying to get out of a parachute because they panicked, so they just stabbed themselves trying to cut it. That's why you have the hook knife now.
That's funny.
Well, I don't think it's funny.
It's
Some
a little
people
bit
didn't
funny.
make it, but
It's a little bit funny, Baker.
yeah, floating around in the Pacific and just aerating yourself.
Oh, Jesus.
Donna, that's a
terrible.
$1 million question. But yeah, this guy isn't good for the state either. Oh, sorry.
That ride?
No.
Do you recall at what point during the ride, would it have been sort of the beginning of the ride or would it have been toward the end?
Toward the beginning.
Now,
Honestly,
with
out of all the
regard to
paramedics, he seems the
clothing
most
that was cut,
honest.
do you recall if it was the sweatshirt, the jeans, or both?
I don't recall.
Do you think, or is your memory that the hoodie sweatshirt was left on him without being cut?
I don't recall.
Where did that clothing go after it was cut by the trauma shears during that ride?
Some of it would stay right on the stretcher, but I don't recall on all of it.
Okay, and some of it could have been on the floor of the ambulance as well?
Potentially.
And then once the ambulance arrives at the hospital, what is the protocol regarding the clothing that had been cut?
It gets transferred over to the RN in charge of the patient and usually stays in their room. Usually they'll put it in some sort of bag.
Okay, and is the clothing put in the bag? Does somebody meet you out at the ambulance?
Because
in order
Lex
to collect the
Friedman doesn't know how to
clothing, or
lie.
do you bring the clothing into the hospital in order to transfer it to an RN?
We bring it in.
And do you recall who it was that brought in that clothing?
No.
Who was with you at that time going into the hospital from the ambulance?
Noddle and Flamati.
So it had to be one of the three of you that delivered that clothing to an RN, correct?
Correct.
Do you know if all the clothing was delivered to an RN or if some stayed in the ambulance?
I don't recall.
And once you give the clothing to the RN, do you see where she takes it?
I don't recall.
Did you go into the treatment room wherever John O'Keefe was brought once he was at the hospital?
Yes.
And you had previously testified that you believed the clothing would have been brought in with him, correct?
Correct.
Do you have a memory of seeing that clothing within that treatment room at the hospital?
I don't recall.
Lips back.
Do you recall seeing the clothing on the floor?
I don't recall.
Okay. Now let's get back to when you first arrived on scene. And actually, but before I get to that, I did want to ask you a couple of questions about where you were at in terms of your career on January 28th, 29th. You were a fairly new firefighter?
Correct.
And you were conscious, you had been trained not long before January 29th, right? It was within several months?
2 months, yeah.
Oh, within 2 months, okay. And your priority as a new firefighter was to follow your training, correct?
Correct.
It was fresh in your mind.
Correct.
You wanted to do things the right way, correct?
Correct.
And particularly at the beginning of your career, you don't want to develop any bad habits, correct?
Correct.
And you were following protocol once you got to the scene as best you could, correct?
Correct.
I believe you testified on direct examination that when the ambulance got to 34 Fairview, as soon as it was parked, you and Anthony Flamati went straight to the body, correct?
I don't recall saying that. I wasn't sure who went straight to the body. I said some of us got some supplies.
Okay. I thought your testimony, correct me if I'm wrong, but I thought your testimony was that you may have gotten some supplies, but then you and Flamati went straight to the body.
Yes, so we did, me and Nuttall.
Got supplies?
Me and Nuttall went to the body.
All right, where was?
But we didn't go straight there. We got supplies first and then went to the body, or I got supplies first and then went to the body.
Okay. How long did it take you to get supplies?
Probably within a minute, I would say.
Okay. Oh, it's a long time.
And where was Flamati when you were getting supplies?
I don't recall.
Once you got to the body, who assisted you with regard to treating John O'Keefe?
I believe it would be the people who were on scene with me.
Who would that have been?
Flamati, Nuttall, Walsh, McLaughlin, Woodbury, and Robery.
Okay. So is it your testimony that your memory is that 5, 6, however many people were there with you, all were hovered over John O'Keefe doing treatment on him?
Not treatment, but getting supplies, getting the stretcher. We're all working together, but we weren't all doing the treatment portion.
Sure, and the treatment was essentially CPR, correct?
Correct.
Chest compressions?
Yes.
And dealing with his airway as well?
Correct.
Which of your coworkers and or you were directly involved with the CPR, the chest compressions, and the airway issues?
I recall that I was doing compressions and helping suction and ventilate in the ambulance, but I do not recall who else was partaking in that.
Okay. So let's talk about when John O'Keefe was put on the scoop stretcher and then ultimately taken to the ambulance. Who was with you when that was occurring?
So it would have been me, Nuttall, Flamati, and Robery, I believe, were trying to get him on the scoop. And then I believe the engine guys were trying to get the stretcher.
Who were the engine guys?
That would be Walsh. It must have been Walsh, Woodbury, and McLaughlin, but I don't recall who exactly was getting it.
All right, so your memory is that yourself, Nuttall, and Flamati were loading John O'Keefe onto the scoop?
I believe so, yeah.
And then from the scoop, he's put on a stretcher?
Correct.
And then
I actually think this guy is pretty okay.
So far,
It's
yeah.
not- yeah, because he just placed Flamati and Nuttall at the body. They both said, one of them said, I was sitting at the body talking to her, looking her in the eyes. We can see from video that's not possible. And the other guy said, I was standing 2 feet in front of her, talking to her. Again, we saw in the video, that's not correct. So he's actually very, very, very damning to what the state put in. But could he, for the
and
love
who
of
would it
all
have
that's
been
good, stop
that
smacking
wheeled
his
the
lips?
stretcher to the ambulance?
I don't recall who it was.
You?
I don't recall.
So you have no memory of who would have taken John O'Keefe on that stretcher into the back of the ambulance?
I don't recall who actually did it, but it would just be whoever's in the best location at the time to move the stretcher.
All right. Do you have a memory of John O'Keefe going into the back of the ambulance?
Not a clear memory, no.
Who went into the ambulance with him?
Me, Nuttall, Formati, Walsh, Woodbury.
Oh, and by the way, once he's on the scoop and then put on the stretcher, the priority is to get him into that ambulance, correct?
Correct.
And part of the reason for that is he was cold, correct?
Yes, sir.
And your priority was you wanted to warm him up, correct?
Correct.
And the best place to do that would have been the inside of that ambulance, correct?
Correct.
So it wasn't that he was put on the stretcher and then there was some detour in terms of where he was taken. You made or whoever took him, made a beeline for the back of that ambulance in order to get him warm, correct?
Correct.
And once he's in the ambulance, the priority at that point would be to close the doors of the ambulance, correct?
Correct.
Because if you leave the doors open, there's a blizzard outside, correct?
Objection.
Sustained. Let's go ahead, Ms. Fiona. Keep moving forward, please.
That's a perfectly cromulent question.
And
You want
so
to keep it hot in
Oh.
there.
the doors were closed to the
But
ambulance,
Lally
correct?
can do whatever he wants for 10 hours.
At some point, yes.
All right. And inside the doors of that ambulance, as you testified, was at least, not naming everybody, but at least you and Nuttall and Flamati, correct?
Correct.
And once those doors were closed to the ambulance, none of you left the ambulance, correct?
None of us, meaning?
I'm talking specifically about you and Nuttall and Flamati.
I don't believe so.
No. You would have remained in the ambulance all the way to the hospital, and that's the point in which the doors would be open, correct?
Correct.
Do
All right.
great to
Now,
absolutely
I'd
destroy
like to
another.
ask you some questions about the scene that you came upon in terms of the people who were there when you arrived, sir. You had previously testified that you saw, I believe you testified that you saw two women and a law enforcement officer already on scene, correct?
Correct.
One
Everyone
of
sees
those
two
women appeared to have blood around her mouth, correct?
Correct.
It was something red, but you assumed that it was blood, correct?
Correct.
And that led you to also believe that she had rendered or tried to render CPR, correct?
Objection.
Is that what you thought?
Yes.
Okay.
She's Lally, you freaking moron. You have two other people
And while you were on
testifying to that.
scene, it was the woman who had the blood around her mouth who appeared to be most upset, correct?
Correct.
She was really upset, correct?
Yes.
Would you go so far as to say she was distraught,
Yes.
hysterical,
Yes.
frantic?
Yes.
And you heard her say, he's dead, he's fucking dead, something like that, correct?
Correct.
And she didn't say it in the tone of voice that I just said it, correct?
Correct.
She was screaming when she said that, correct?
Correct.
It was very easy for you to discern that her words were, he's dead, he's fucking dead, correct?
Correct.
And she repeated it more than once, correct?
Correct.
And it's fair to say that at no point in time did you ever hear her say, I hit him, I hit him, I hit him, correct?
Correct.
And you would agree with me, sir, that you have been extremely consistent in terms of your memory of what she said, correct?
Correct.
You've been asked these questions not for the first time by Mr. Lally or me in court today. There have been other occasions where people have asked you, what did the woman with the blood on her mouth say when she was on scene, correct?
Correct.
You were asked that by Trooper Proctor on February 9th of 2022, correct?
I don't recall.
It's probably unfair of me to say the date, but you do recall speaking to a state trooper not long after these incidents, correct?
Correct.
And to that state
You're a little
trooper,
behind secret.
you told him that what she said was, he's dead, he's fucking dead, correct?
I don't recall.
You don't recall saying anything differently than that, do you?
I remember saying a lot differently, but I might have also said that. I just don't recall.
Well, you don't, and let me rephrase that. You don't recall changing her words at all. You recall, you've always said he's dead, he's fucking dead, correct?
Correct.
That was not only to the state police on February 9th, but then in April of 2022, you were in a grand jury setting, correct?
Correct.
There was no defense attorney there on that day, correct?
I don't believe so.
You don't remember seeing me there?
No, I didn't see
Okay. Mr. Lally was asking you the questions, correct?
Correct.
And there, you also said that what the woman with the blood on her mouth said was, he's dead, he's fucking dead, correct?
Correct.
And you've testified to that today?
Yes, sir.
You've never changed that story, correct?
Correct.
And that is because the truth does not change, correct?
Correct.
I like that.
Yeah.
All right, at this point, I'd like to play a 15-second portion
everyone
of
else
the
lied.
video, which I would offer as the next exhibit, Your Honor.
Okay, so we'll watch it and then you
Thank
can
you
offer
very
it
much.
with no narration, right?
Never.
With no narration.
And, before you start, I'm not as interested in the video, sir. I'm interested in the audio. So if you could, listen as best you can.
Sure.
Would you agree with me, sir, that we heard what you heard that night, which is, he's dead, he's fucking dead?
It was kind of hard for me to hear. I heard about, does he do drugs? I couldn't really hear the background.
Okay.
Yeah, that I couldn't hear that. I tried to, when we had those listen, I tried to close my eyes and not get the audio thing. Maybe microdots can clear that up. I shouldn't do that. Hey, Jamie, welcome back.
Sorry, I got a phone call. Weird.
No, he was a very new guy on the job, so that could be it.
He's still young enough that he doesn't know better, right? He doesn't know that he might be getting his buddies in some trouble with his testimony yet.
Yeah.
Mr. Kelly, I got permission to play it one more time.
I'll try my best.
So again, and by the way, before it's queued up, I would direct your attention more toward the beginning of that 15 seconds. As there are things that happen, I think, that you heard at the end, but you tell us if you can hear, or what you can hear.
Okay.
He had blood around his nose too, yes. Yeah, I could hear he's dead.
What did you hear?
I heard someone say fucking dead.
Thanks.
Okay. Any redirect?
Just briefly on.
Probably not briefly.
On that video, it was just up on the screen. You indicated that when you got to the scene, you saw the cruiser parked sort of behind you, correct?
Around the cruiser, yeah.
So from that video, you didn't see the ambulance that you were driving anywhere in, correct?
Correct.
You have no idea whether or not you were even on scene at that time that any of those statements that were made in that video were made, correct?
Correct.
Now, as far as patient care was concerned, were sort of
matter.
all of you, being yourself, firefighter Flamati, firefighter Nuttall, firefighter McLaughlin, firefighter Walsh, firefighter Woodbury, were you all together all the time, or were you doing separate things in separate places during the course of your time?
Paramedic, not firefighter.
Separate things in separate places, yeah.
So fair to say that everything that you heard may not be everything that someone else that was there from your department that day heard, correct?
Correct.
And conversely, something that someone else heard may not
How
be
could he
necessarily
possibly
something that you were in a position to
testify to
correct?
that?
Correct.
You also asked some questions about sort of using the shears and cutting off Mr. O'Keefe's clothing during the ride. Is it your testimony that that was in the back of the ambulance, correct?
Correct.
Was that during the transport, or was that prior? Would you be utilizing shears on a patient, cutting off clothing while the ambulance is in transit?
No.
So if it was in the back of the ambulance, that would have been prior to the ambulance leaving the scene and going to the scenario, correct?
Correct.
Nothing.
Your Honor, the only thing I would offer is the video that I played. I have
All
it.
right, so we will do that.
Thank
So,
you.
Mr. Clerk, it's already been pre-marked, right? Do you not have it, Nancy? Okay.
Oh, I'm sorry. I was mistaken. It has not been pre-marked.
The exhibit 380.
Thank you.
Thank you.
Yeah, I don't know that the other two paramedics are like intentionally lying, or if they're just, convinced themselves of what they think they heard and saw.
All right, so we're all set?
They said talks a lot about it.
Okay, thank you. You're all set. Sir.
Thank you.
I think Lally knows. I think Lally understands that he's getting his ass kicked in this one.
I bet
Your
he's
next
talked to
witness.
Beth.
Yes, Your Honor. Call Mr. Francis Walsh to the stand.
And that's why they had to change it. So another EMT guy.
Walsh?
Another paramedic.
Tori, what do you have for today? Numbers.
Watch your stuff.
You tell us where the evidence to give the court and jury in the case down here and should the truth, the whole truth, and nothing but the truth, so help you God.
Okay, whenever you're ready, Mr. Lally.
Thanks, John. Good afternoon, sir.
Good afternoon.
Could you please state your name and spell your last name?
Francis Walsh, WALSH.
And what do you do for work, sir?
I'm a lieutenant paramedic.
Oh my God! Why did they all do it?
And how long have you been a
It must be a bastard thing.
Oh my
firefighter
God!
paramedic with Canton Fire Department?
Just shy of 10 years.
Now I hear it. Stop.
You indicated that you have a rank of
I
lieutenant.
didn't hear it
That's
before.
correct.
How long have you been a lieutenant with Canton?
Since September of last year.
Now, with regards to, you have certifications both as an EMT and a paramedic, correct?
That's correct.
And with regard to those certifications,
That's the rule.
When was it first that you sort of received those?
I received my paramedic certification in June of
Thanks a lot. That's now that's
2014
all I can hear.
when I was officially certified.
Is that something that you've been subject to sort of continuing educational components and recertification since then?
Yes, yeah, every 2
I
years.
didn't
we have
realize
to
I hated
recertify,
Massachusetts
take
so much.
continuing
I
education
absolutely do,
classes.
though. I absolutely
Is your
do.
certification up to?
Oh my God!
They can't drive in snow when they
Certification up to
it.
speed at this point?
Yeah, it's current. I just recertified last month, actually.
So, an hour left.
Now,
Will we get
if I could turn your
anywhere
attention
close to the crime scene?
The evening of January 28th.
Or will it be
January
the weather
29th,
report?
2022. You recall that day?
I do.
Were you working that day with the fire?
I was.
And what kind of shift were you working on that occasion?
24-hour shift, which is standard.
Is that 8 a.m. to 8 a.m.?
That's correct.
That, correct me if I'm wrong, but that would be 8 a.m. on the 28th until 8 a.m. on the 29th?
That's correct.
And so where were you assigned to on that particular day?
I was assigned to headquarters, which is on 99 Revere Street, and my position was engine driver.
So fair to say people within your department get different sort of assignments on different apparatus based on the different shift that they're working.
That's correct.
And your assignment that day was the driver of the engine?
Correct, yes, engine 3.
Now, beyond sort of your assignment as the engine driver in that particular shift, what, if any, sort of specialized assignment do you have, or did you have at that time in regards to snow removal?
Yeah, so on that particular shift, I was also the snowplow driver. We have an in-house truck and a snowplow for the fire department, and that was my responsibility on that shift.
How many people within your department have that sort of responsibility when it comes to
it kind of depends group to group. So some working groups will just kind of rotate and have a different person do it each time. At that time, the group that I was on, I kind of had the most experience plowing, so I was always the go-to person to be in the plow truck when it snowed.
And so with respect to that, Dewey, about what time did you sort of get up on that morning of the 29th?
I believe it was around 4 a.m.
And why was it that you got up at that time?
It was snowing pretty heavily. I mean, we knew the forecast called for a lot of snow. So I got up early and hopped in the plow truck.
And so, and just briefly, in addition to the snow, what, if anything else, did you observe as far as weather conditions when you were out in the plow truck?
It was very windy. Just windy and really heavy snow.
They really don't like the
at some point,
either.
Shortly after 6 a.m., does your department get dispatched?
Sorry.
Yes.
And where was the dispatch to, and what was it in regards to?
So
how do you do that? How do you make that much noise without?
I was in the rear of headquarters in the plow truck, but my Captain Robery, came out and told me that we had a call for 34 Fairview Road for an unresponsive male party, and he told me, to hop in the engine and head to that call.
And when you hop in the engine, who, if anyone else from your department, was assigned to the same engine as you on that day?
So I had Lieutenant Woodbury to my right in the passenger seat, and Firefighter McLaughlin in the rear.
And beyond the engine that you were driving, what, if any, sort of other apparatus?
You are so far behind Secret Squad.
So that would have been ambulance 1, and then also car 5 went as well. It's kind of like an optional thing, but with a call of that severity, the captain will go as well.
And who
is weed legal in Massachusetts?
I don't know. Grant smokes it all the time, doesn't he?
Yeah, but it sounds like they have massive cotton mouth.
was in car 5 on that day?
Captain Robery.
And you drove the engine, is that correct?
That's correct.
If you could describe for the jury sort of what you observed as far as the road conditions, visibility, things that like en route from the station to Fairview.
Yeah, so it was really, really poor driving conditions and visibility. I can't recall ever driving to a call of that nature and that severity that slowly.
What the F is going on in Massachusetts? We've seen the pictures. It wasn't that bad. Jesus.
The visibility was so poor that we were just driving extremely slow.
Hey, Bibsy.
Okay. And from, if you could describe to the jury sort of the route of travel that you took from Station 1 to Fairview.
Sure. So out of Station 1, take a right onto Revere Street, and then a left onto Sherman Street, a right onto Chapman Street, and then a left onto Fairview.
Now, if you recall, what was sort of the order? You're all sort of dispatched and you're all sort of responding around the same time, being car 5, the ambulance, and the engine, correct?
Correct.
And if you recall, what was sort of the order of the vehicles in response?
So engine 3, we were the last vehicle for the fire department to arrive on scene. So when we arrived on scene, ambulance 1 and car 5 were already on scene.
And if I could ask, just sort of as you're turning onto Fairview Road and you travel down, what, if anything, do you know about sort of the elevation of the roadway as you're driving down through?
It's a downhill grade. Yeah, it gets a little bit steep at one point.
And the residence that you eventually stopped at or responded to, where was that in location in reference to when you first turn on Fairview, about how far down is the residence that you eventually go?
Pretty far down. I believe it's one of the last houses on Fairview.
And the residence that we're talking about, is from your perspective when you're driving down there, is that on your left or right or something else?
Left.
And as you're approaching the scene, what is it sort of that you see before you, as you know, how do you know where to stop and where you're going?
Yeah, so I mean, like I said, visibility was really poor, but there was ambulance 1, car 5, at least a couple of police cruisers on scene before us. So it's kind of hard to miss that. So that's how we knew where to stop.
Now, in regard to you're responding to an unresponsive man, correct?
Correct.
And just to be clear, at some point you were able to identify, or you were told what the identity was of that unresponsive male patient, correct?
That's correct.
What was his
name? John O'Keefe.
And so with respect to Mr. O'Keefe, as you're approaching the scene, when was the first time that you were able to sort of see where Mr. O'Keefe was on scene when you arrived?
It wasn't until a little bit after we actually arrived on scene that I could see the patient, because as we pulled up, the ambulance was blocking our line of sight to where the patient was. So I couldn't see him right away.
And what was sort of the I know you talked about visibility, but as far as, had the sun come up yet?
No, it was pitch black.
And so when you arrive on scene, what is it that you and sort of the other people on your engine are doing in relation to patient treatment?
So at that point, I got out of the engine and I started walking towards where the ambulance crew was. But at that point, firefighter McLaughlin was coming around to the rear of the ambulance to get the stretcher out. So I went directly to that to give her a hand with that. And we proceeded to bring that around the front of the ambulance where firefighter Nuttall, Flamati, and Kelly, and I believe Captain Robery were working on the patient.
Now, in reference to where patient Mr. O'Keefe was, where was he? Could you see sort of how in reference to the ground?
I could see they had, the other firefighters and captain that I just mentioned had just put him on the backboard at the first time that I saw him. I'd say that was like roughly 10 feet in from the road.
And to that point, how were you able to say that it was approximately 10 feet in from the road?
Just an estimate.
Let me ask you, as far as the stretcher was concerned that you and firefighter McLaughlin retrieved, where did you place that in relation to where Mr. O'Keefe was when you first arrived over?
So we placed that, we decided to leave it on the street and get it as close to the grass or snow as possible. It was unspoken, but we knew that we didn't want to put the stretcher onto the snow because it would be too unstable. So we put it right up against the curb. So right at the edge of the street where the street meets the yard.
And so you put the stretcher basically right up against the curb, and Mr. O'Keefe was approximately 10 feet from that.
That's correct.
And with respect to positioning the stretcher, was that parallel with the curb or perpendicular to it, or how was it?
Parallel.
And you mentioned that obviously Mr. O'Keefe is on scene, and there are a number of different firefighters from your department, correct?
That's correct.
There was at least a police cruiser. Did you see any officers sort of around the scene?
Yes, I remember Officer Saraf and Sergeant Good.
And with respect to civilians, what, if any, civilians did you observe around the scene?
I observed 2 female civilians.
And where were they in relation to where you were or in relation to where Mr. O'Keefe was?
I mean, they were pretty worked up, so they were moving around quite a bit. But I'd say they were somewhere in between myself and the stretcher and where Mr. O'Keefe was.
And did you yourself have any conversation with either of the two females?
Hey, Moni.
I did not directly, no.
And you just testified a little bit before that they were upset. Is this so both of them were?
Yes, yes.
And what, if anything, leads you to that sort of conclusion as far as their demeanor? What, if anything, did you specifically observe?
I mean, I observed one of them like screaming and crying, and they were both just frantically like moving around a lot.
As far as the one that you observed screaming or crying, do you recall specifically what, if anything, that person said?
All I recall her saying was, "Is he alive?"
With respect to Mr. O'Keefe, as far as his clothes, what, if any, observations did you make of his clothes?
The notable observation that I made was that he was missing one shoe, his right shoe.
And where was Mr. O'Keefe when you made that observation of missing one shoe?
It was when we put the stretcher into the ambulance, the stretcher lifts up, so it's kind of right at my face, and that's when I noticed it.
So at the time he was being placed in the ambulance, you only had one shoe based on what you said.
That's correct.
Now, once Mr. O'Keefe is in the back of the ambulance, where did you go?
So I stayed down at the feet. I was positioned right by his right leg.
And what, if any, difference did you know between sort of the lighting conditions outside on the lawn versus the lighting conditions in the back?
In the back of the ambulance, it was dramatically better.
And so once in the back of the ambulance, what, if anything, did you note or observe as far as injuries to Mr. O'Keefe?
I noticed a hematoma on his right eye, and I noticed some blood coming from his nose.
And just to be clear for the record, so when you say hematoma, based on your training and experience, can you explain what your understanding of that term is to the jury?
Swelling and bruising.
Now, at some points, with respect to the clothing that Mr. O'Keefe was wearing, what, if anything, did you or other firefighters or paramedics from your department do with reference to Mr. O'Keefe's clothing?
We removed all of his clothing.
And let me first ask, how was that removal sort of accomplished?
Can you repeat that?
When you removed his clothing, how was that? How did you do that?
Oh, with trauma shears, basically scissors that cut clothing.
And,
Are they going to try to put that in
once,
as the
sort of
injuries to the arm?
was that pursuant to some sort of protocol, or
Yes.
why was the clothing?
Yeah, on any trauma call, it's protocol to expose the patient so you can see all injuries and you don't miss any injuries.
And once the
See what he's
clothing
working
removed, was removed with the trauma shears, what, if any, additional injuries or anything did you observe?
I noticed some scratches and lacerations on his right arm.
Now, in reference to treatment in the back of the ambulance with regard to Mr. O'Keefe, what, if any, sort of role in that did you sort of assume, or were you sort of assigned by the lead paramedic?
Yeah, so I was responsible for the IO drill and access. It's an intraosseous access.
Can you explain to the jury sort of what that is and how that's accomplished?
Yeah, so you do that instead of IV access. So when somebody's in cardiac arrest, it's really hard to get an IV. So what you do is you actually drill into a bone, and you can administer medication and fluids like into the bone marrow space.
Patty B, there's a reason why we do it. It's because they don't have any hard evidence. So they need to show the jury as many witnesses as possible. So the jury thinks, oh, we saw 70 people. They must have said something. I just forgot it. And as someone stated earlier, yes, this guy never heard her say, I hit him, I hit him, I hit him. He said the same as the police officers. Is he alive? So those two EMTs, I'm not saying they're lying. They just probably made it up when they discussed it later, because it's a stressful situation.
And so pursuant to, so Mr. O'Keefe was undergoing cardiac arrest, correct?
Correct.
Could you explain your understanding of that term based on your training experience to the jury? What is cardiac arrest?
There's no cardiac function. His heart isn't pumping blood anymore.
And so what, if any, sort of protocols are there as far as medication administration is there in reference to a cardiac arrest?
Yeah, so the frontline medication for that is epinephrine. That's what we gave through the IO access.
What is the purpose of the epinephrine?
Epinephrine, I mean, basically in layman's terms, it gets the heart pumping again, if that's a viable option.
And in addition to the epinephrine, what, if any, other medication was administered through the IO?
I believe that was it. As far as when I was on scene, it was just epinephrine.
Do you recall anything about salines?
Oh yeah, saline as well, but it's not a medication. But yeah, we also administered saline.
What is the purpose of the saline?
Saline is just to increase blood volume.
Now, as far as
I thought they didn't give saline anymore because it
as far as the
dilutes the blood.
transport, Mr. O'Keefe has been taken from Seasville Hospital, correct?
Correct.
Did you go along with the ambulance on the transport to the hospital?
I did not.
So you remained on scene leave for some period of time,
I think
correct?
it depends.
Very
on-
briefly, but yes.
There's certain injuries that you
You
wouldn't want to
referenced
give
some
saline for,
officers from the Canton Police
right?
Department.
Like if you've got like a
Correct?
Correct.
And without
Completely
reference to
open
anything
belly or
said,
something.
which of them, if any?
I thought they
have
just get
conversations
the
prior to meetings?
gave you those
Sergeant
with a
Good.
lot of blood plates in it, so
And
you can plug up.
just as far as what you told Sergeant Good, what, if anything, did you
I could
relay
be
to
wrong.
him before you left the scene?
I relate to him that there were signs of trauma in the patient.
Also, if you're sticking
And
it
did
in
you
the
give
bone
it
marrow,
any
it
sort of
probably
further explanation as to
dilutes
signs
blood
of trauma
too
that you
much.
observed?
Yes, I believe I told him what I told you about the hematoma on the eye and the blood in the nose and the scratches and lacerations on the arm.
So you told Sergeant Good what you've just testified to this jury that you observed?
I believe so.
What about the head wound?
Ms. Kelman, if I could ask for exhibit number 18.
What about the head wound? No one still has mentioned anything about the head wound.
Firefighter Walsh, what's up on the screen is exhibit 18. Do you recognize that?
Yes, 34 Fairview Road.
Is that fair, minus whatever the weather conditions are, fair and accurate portrayal of what you observed that day at 34 Fairview?
Yes.
And approach witness agree with it?
Yes.
Yes.
So this is again a later point.
Okay. That's my biggest problem. No EMTs have testified, and
So Firefighter Walsh, if I could
that
ask
would
you
be a
in that later
gotcha.
pointer, if you could direct the jury's attention to where within this photograph did you see that you observed Mr.
But
O'Keefe's
now you
body
can't
first?
unhear it.
Right in that general area.
Thanks. May I have one moment, Ron?
Yes.
He was in the ambulance. He just testified that he saw it way better inside the ambulance.
No further questions for this witness, Your Honor.
All right. Cross-examination?
Yes.
Oh, wow, that was fast.
Good afternoon, sir.
Good afternoon.
I just want to ask you about the woman that you saw on scene who appeared to be screaming and crying. Would you agree with me that she stood out to you because she appeared to be the most upset
Yeah, I would agree with that. Yes.
and the loudest?
Yes.
She appeared to be crying more than others,
Yes.
and she was screaming, right?
Yes.
And what you heard her say, I understand your testimony, was that she just said, "Is he alive?" Correct?
That's what I recall. Correct.
In a loud voice,
Yes.
in a distraught voice,
Yes.
while she was crying.
Correct.
I have nothing further.
There's nothing, Mr. Lally, right?
No.
All right, you are all set, sir. Thank you.
Thank you.
Who is your next witness?
Ms. Katie McLaughlin.
Oh, go ahead.
If this lady smacked her lip, I swear.
Yeah. Then Jamie stream solo tomorrow.
Can you raise your right hand? Do you solemnly swear the evidence you give the court and jury in the case now and hearings for the truth, the whole truth, and nothing but the truth, so help you God?
Hello.
Thank you. You can have a seat. I just need you to speak into that microphone nice and loud.
Oh, wait a minute.
Okay, whenever you're ready, Mr. Lally.
Sorry, nurse. I feel some heart palpitations coming
Oh
on.
my God.
You know what? I don't even mind if she smacks her lips. I changed my mind. It's okay. It's okay if she does.
Yeah.
Calm down, boys. Calm down.
Could you please state your name and spell your last name, please?
It's Katie McLaughlin, McLaughlin.
And what do you do for work?
I'm a firefighter paramedic for the town of Canton.
And how long have you been a firefighter paramedic?
Probably about 7 years at this point.
And prior to working for the Canton Fire Department, what, if any, other work did you do sort of within that
I worked as an EMT basic for Brewster Ambulance.
She has a cross on. She's a good Christian woman. This is a good Christian channel.
Okay.
I don't know what the problem is.
Went to paramedic school. I eventually became a paramedic for Brewster Ambulance, and I worked there for a few years before getting on the fire department.
And how did you pay
And just briefly, but
EMT school?
prior to becoming a paramedic or working as a paramedic, what was sort of, what if any sort of training you used in regard or certification you used in regard to being a paramedic?
So it's a 2-year schooling where you have about a year of didactic. There's a lecture portion for about a year. And then after that, there's about a year to a year and a half of clinical training that's done in an ER and then done in an ambulance. So that whole period is around 2 years.
And prior to working in the Canton Fire Department, you received certification from the state or some other sources being a paramedic, correct?
Yes, it's through the state and through a national registry.
And both those certifications through the state and the national registry, are those granted sort of forever, or is there like a continuing educational component and a recertification process?
So you recertify every 2 years. You have to take continuing education classes in that 2-year period. And that's just on a 2-year cycle, you recertify.
And your certification is up to date at this point, is that correct?
Yes.
And if I could turn your attention to the dates of January 28th, 2022 into January 29th, 2022. Do you recall those dates?
Yes.
And were you working with the Canton Fire Department on those dates?
Yes.
Do you recall what kind of shift you were working from the 28th to the 29th?
It was just my regular 24-hour shift.
And 24-hour shift in Canton Fire is essentially 8 a.m. to 8 a.m., is that correct?
Correct.
And where were you sort of assigned within the town of Canton Fire Department on that day?
So I was on the engine for that shift. So I was the third person on the engine. There's an engine driver, there's an officer, and then there's a third person who's in the back.
And so your sort of role with respect to the engine, is there sort of like a name for that position?
Some people call it like the back step. Yeah.
And which station house were you assigned to on engine?
The Station 1, which is 99 Revere Street.
And in addition to yourself, who, anyone else was assigned to the other sort of roles on the engine?
Really?
Frank Walsh was the engine driver that day, and Greg Woodbury was the lieutenant on the engine that day.
Now, turning your attention to that morning of the 29th, do you recall about what time you got up or what time you went outside that day?
I think we were up maybe a little before 6 because it was snowing, and we had to like shovel the front apron. So we were up maybe 5 a.m.
So when you were up around that time, around 5 a.m. and outside, you were outside shoveling, is that correct?
Yep. Intermittently.
Sorry?
Intermittently, yeah.
So during the times that you were outside shoveling, what, if anything, did you observe as far as the weather or conditions at that point?
It was snowing pretty heavily. It had been snowing. We were shoveling, and it was pretty cold and windy.
And if you know around that time that you initially sort of went out and shoveling, about how much snow had accumulated at that point?
I don't know how much. I mean, enough for us to shovel that front apron, but I don't know how much.
Sometime shortly after 6 a.m., were you and other members of your department dispatched to a call?
Yes.
And where were you dispatched to, and what was that dispatching?
So the call came in as a man down in the snow or a man unresponsive in the snow, and the call was 434 Fairview Road.
And about how long was it from the time that you sort of received that dispatch and go sort of on the engine to that residence on Fairview
How long? We're on the truck and going probably within a few minutes at most.
And so in addition to yourself and firefighter Walsh and Lieutenant Woodbury, what, if any, other sort of apparatus from your station was dispatched to this call?
The ambulance was dispatched as well, and I believe the command car 5, also was dispatched to the call.
And as far as car 5, if you recall, who was in car 5?
At the time, Captain Robery.
And with respect to the ambulance, if you know who, if anyone, was assigned to the ambulance and went with the ambulance?
Firefighter Kelly and firefighter Flamati were on that ambulance, and I believe Tim Nuttall was also there. He came in early, and so he jumped on the ambulance as well.
And with respect to when you get to Fairview Road, do you recall what sort of order the vehicles were in as far as car 5 and the ambulance and fire engine?
I think car 5 was maybe first, and then the ambulance was in front of us, and then we pulled up behind the ambulance.
And so when you sort of arrive on scene, pull up behind the ambulance, other than vehicles from your department, what, if any, other sort of vehicles did you observe or see on scene that day?
I noticed there were
I cannot hear the
police
smacking
vehicles, and
It definitely got
at least one civilian vehicle.
Yeah.
Now, obviously, you're responding to a report of a non-responsive male, are you correct?
Yes.
And when you're sort of first arriving on scene, or just in reference to when you arrived on scene, when was the first time that you were able to see that unresponsive party?
So when I got out of the engine, I went right back to the ambulance to get the stretcher, because I knew that from wherever they were, they seemed to be kind of in off of the road. So I got the stretcher with firefighter Walsh, I believe, and then we brought the stretcher as close as we could to the patient, and that was like parallel to the curb, and that would be the first time that I observed them working on a patient.
And so if I could just ask you, just with regard to sort of those duties as the backstep person, so what is sort of the duties and responsibilities of the backstep person on the engine to this kind of medical call?
So the role of the person in the back of the engine is, it kind of is dependent upon what that lead paramedic needs you to do. You're there to assist the ambulance in any way that they need. So that could be assisting with extrication of a patient. It could be obtaining information about a patient or bystanders. It could be assisting with patient care if they need you in the back of the ambulance. It really depends on what they need you to do for that particular call.
And turning back to your testimony just a moment ago, you said we're over rendering.
It depends on how bad her testimony turns. If they don't get into it and she's just, I got the stretcher and I didn't really hear her say anything. Don't get into it, because there's no need to. If she doesn't come in with something damning, it'll just kind of show you a little petty.
Sort of patient care, is that correct?
Yes.
What do you mean by that?
I noted Tim, I noted Tony, and there were a lot of people that seemed to be around that area. So I'm not sure exactly who else was there, but I did note Tony and Tim were in that area.
Yeah, and if Lely didn't bring it up
in
with
that
every
area,
witness.
Where Tony and Tim, so people sort of beyond people from your department, what, if any, other sort of people did you notice around that area?
I don't know specifically. What do you mean? Like
as far as
outside of the,
right. So outside of fire department personnel in that area, what, if any, observations did you make of those people? Who were those people?
Well, at that point, I couldn't really make out like the identities of like other people. I noted Tim and Tony, but I didn't really pick up on who anyone else was at that point. They were still like in off of the road at that point.
And so from where they're positioned with regard to the patient, just for clarity purposes, you were subsequently learned the identity of the patient, correct?
Yes.
And who did you learn him?
John O'Keefe.
And where you and firefighter Walsh were with the stretcher, how far away from where you were was Mr. O'Keefe and the other firefighters?
They were, I don't know that I could give a number, several feet away. They were like,
do you know? Or
I
don't
remember
you
kind of
know?
seeing a fire hydrant,
That with the,
but I don't know
defense.
exactly number wise, what that would be.
Funny, Biff
And
didn't
from
jump
your
in there.
observation of where Mr. O'Keefe was, could you tell how his body was positioned?
He was supine, so he was lying on his back or face up.
And what, if anything, by the time that you arrived with firefighter Walsh on the stretcher, what, if anything, could you see that firefighters Fulani and or Nuttall or anyone else was doing with reference to Mr. O'Keefe?
By that point, it seemed like they had already got him pretty much secured on a backboard, and they were ready to move him to the stretcher.
And once Mr. O'Keefe is then moved with the backboard from where he was to the stretcher where you are, what happened?
So I remember Tony was kind of at the head of the stretcher. I was standing on the side. There was a woman next to me, and Tony said to me, "Can you try to figure out what happened?" And he kind of motioned to this woman that was next to me.
And so firefighter Fulani, who's the lead paramedic, directs you to ask some questions of this female, correct?
Yes.
And fair to say this woman that was next to you, you didn't know her, you never met her before?
No.
From your conversations with her that day, do you see that woman in the courtroom today?
Yes.
You can just direct us to where she's seated or an article of clothing she's wearing. That's a record of like identification.
Okay.
Now, with respect to this woman, she's standing next to you when you're at the side of the stretcher, correct?
Yes.
And what, if any, observations did you sort of initially make as far as her demeanor, or how was she sort of acting when you first started to engage?
She seemed very upset. Very upset.
And when you say she seemed very upset, what about her did you observe that made you say that?
Just her facial expressions. She was just visibly distraught.
And so as far as your questions, what type of questions are you asking, or what type of information are you looking for from this person?
So just basic demographic info, who the patient is, his name, his date of birth. And then as far as any more questioning, you're trying to gather information that would basically help explain how this person ended up in the scenario that they're in. So did he have any medical problems?
Sorry, ladies, I have to ask. This sharp of a cheekbone, is that makeup? You can't have that sharp of a cheekbone. Is that something you do with contour or something?
Does he take any medications daily? Does he have any allergies to medications?
Really, really sharp.
I was asking those questions.
And as you're asking those questions, what, if anything, is the defendant doing while you're asking?
I killed him. I hit him.
She answered who the patient was, his birthday. I think she answered maybe some of those initial medical questions that I asked. But as I said, she's very distraught. She was kind of moving around the scene a little bit. So I was just kind of following her, and then we came to a stop at one point, and I continued to ask one more question.
What was that one more question?
So at that point, I asked her if there had been any significant trauma that happened before this.
And she said, I hit him with a car.
So she said, I hit him. She repeated it. There was a woman standing across from her who I believe at that point said, you're hysterical. You need to calm down. You're hysterical. She repeated, I hit him. And there was a police officer who was in that vicinity kind of with us who replied, you what? She repeated it one more time. And that officer then signaled to somebody, get Goody down here, which I'm assuming would be the sergeant.
So nobody did anything once again.
Did you report that to anyone?
Did that police officer that heard it, did he do anything?
So we have this conversation.
We haven't had Goody on yet.
You mentioned that the other person who was across from you was just, was that somebody from your department or an officer or a civilian, or who was that?
So I was standing, Karen Reed was to my right. There was another woman to the left of me, kind of across from her. And then there was a police officer kind of, not directly across from me, but within the same kind of area that was more closer to Karen, I would say.
You know who that officer was?
I don't.
You know who the female or civilian person that was crossing? You know what that person's name is?
No.
And with respect to when Ms. Reed said this repeatedly, I hit it. Describe for the jury sort of the
I really
reality
hope
of
she
that.
didn't mention that anywhere until the.
She
after
seemed,
Proctor.
she was very, very upset. She seemed hysterical, I would even say.
That'd be my guess.
Just very upset.
But once you received that information, did you follow up with any other questions to Ms. Reed at that point?
At that point, I did not. I have to drive the ambulance, so it's a time-sensitive situation. So I knew I had to drive the ambulance. It was said in the presence of the police officer, so I felt like that was the appropriate, that information was appropriately transferred. And I just felt, based on her demeanor, I don't think it would have been productive for me to continue to ask her questions at that point.
That's such a stupid answer because you just said she clearly stated to you, you stopped and you asked what happened. I hit him. Someone said, you're hysterical. And she said, I hit him. An officer said, what did you say? I hit him. Get Goody down here. But then all of a sudden, she's way too hysterical to talk to you.
Right. Like, why does no one want to find out any more information so they can give it to the hospital?
Well, you know, it's pretty common procedure, as far as I understand, when a cop hears somebody potentially admit to the ending of another person, that they just kind of let them go away after that. They usually don't follow up or
Question it at all.
Yeah, nah. Oh, this dead guy in the grass, you might be responsible. No worries, we'll catch up later.
If you just go home, get a cup of hot cocoa, we'll catch you later.
Go destroy any evidence that you may or may not have on the vehicle. Yeah, no big deal, guys. No big deal.
Let's see if she will. We'll run out the time, so we'll start with her tomorrow if we come back tomorrow.
And so after him receiving that answer of I hit him, where did you go?
So I went to the ambulance.
And in reference to the ambulance, did you go to the back of the ambulance, in front of the ambulance? Where did you go?
So I went to the back of the ambulance where the patient care was happening.
And as far as the information that you had received from the defendant, did you relay that information to any of the other firefighters from the department in the back of the ambulance?
I did.
And you recall who was there in the back of the ambulance when you relayed that?
Tony was there, Tim.
And none of them have said that.
Maybe firefighter Kelly,
None of them
firefighter
said
Walsh
that.
maybe might have been in there at that point.
Told all the officers who never heard it.
To the back of the ambulance, what, if anything, did you do with reference to assist or help as far as patient care with regard to Ms. O'Keefe?
I didn't assist or partake in any patient care.
Now, prior to putting Mr. O'Keefe into the back of the ambulance and prior to your conversation with the defendant, what, if any, observations had you made during the brief time that you were on the side of the stretcher of Mr. O'Keefe and any injuries?
I noted he had injuries to his face. I noticed some blood from his nose, from his mouth, and most notably, he had some swelling to his eyes, mostly the right eye, and a laceration above the right eye.
And same as far as when you went to the back of the ambulance to relay the information that you have been asked to obtain. What, if any, injuries did you observe from Mr. O'Keefe once he was back?
Oh, I'm sorry. I observed those injuries in the back of the ambulance. I didn't observe those injuries while he was out on the stretcher. I didn't get a good look at him.
You really hadn't got a good look until
Right.
back.
Right.
Now, as far as you indicated, you drove the ambulance from Fairview. Where did you go to?
Good Samaritan Hospital.
And as you were driving that ambulance along the roads from Canton to Rockland, what, if anything, did you know as far as visibility, road conditions?
There was poor visibility. The roads weren't plowed yet, so it was took probably longer than usual based on the conditions.
And I apologize, but if I can take you just a step back further for a moment, just in reference to when you're in the back of the ambulance, indicated the injuries that you observed. What, if any, observations did you make as far as the clothing that Mr. O'Keefe was wearing?
I noted that he was wearing jeans. I noticed a lighter, like a black zip-up jacket or sweatshirt. It was like a lighter jacket. I noticed he had one sneaker on, and that was it.
You recall which foot the sneaker was on?
I don't.
All right, could I see counsel for a second, please?
And we're live.
Yay.
Yeah, so now we're gonna stop. But if anyone wondering who this lady is, this is her. Drinking with the Albert's daughter.
Oh, that's the Albert's daughter there. Oh, weird.
Oh,
Yeah.
isn't that going to be cute?
Weird.
Yeah, Uncle Albert is the guy who's in the house. So she probably knew the house. He probably been drinking there because it seems like it's a hangout spot to drink. The cheekbones is way too sharp. So, but she just testified that she told every EMT in the back of the ambulance that she was relayed that she hit him.
Yeah.
We have had 1, 2, 3, 4 EMTs testifying. 2 of them, we heard it from Karen Reed herself. One of them testifying, is he dead? And the other one, something about, is she effing dead? Funny that none of these 4 guys who were in an enclosed area with her, not outside in a blizzard, didn't hear her say, hey, fellas, while you're doing that, can I just tell you, this crazy lady just said, I hit him. She stated it 3 times very clearly so I could hear it. The rest of it, I really didn't hear anything. But I'll jump in and drive the ambulance now. See you later. Jesus.
Just trying to figure out some logistical things because we're going to go on a view tomorrow. We're going to finish with the testimony first, and we'll go on the view after we finish with firefighter and testimony. So, but a couple of things about the view.
What?
Please dress comfortably. I really appreciate everybody's dressing respectfully for court, but wear comfortable shoes at least for tomorrow. So those 3 cautions, please do not discuss this case.
So we're starting
Don't do any
with her
independent
testimony
research
in
or
the morning
investigation into
going
the
on the
case.
view.
If you happen to see, hear, or read anything
Half
about
a
the
day again
case,
tomorrow.
please disregard it and let us know. And for the view, I'll give you some preliminary instructions on
I
that.
can't send Grant anything.
Thanks, we'll see you tomorrow. And tomorrow's a full day.
Brandon, it's because in Massachusetts they hate snow and they're communists. Did she say it was a full day tomorrow? I'm just gonna.
That's what she said. That's what she said.
Yeah, she said a full day tomorrow.
And tomorrow's a full day.
All right, for the
Oh,
court, please.
so they'll come back after the trip?
Apparently.
Yep.
That does make sense.
Well,
It's only going to take a little time.
yeah, it can't be that far away, right? 10 minutes or something.
Yeah. And they just got to look at where he was.
Have you seen this case, Jamie? It takes them 40 minutes to ask about what's your shift at work.
Well, it's not like they're going to be questioning the jurors on scene, so.
Can't we, Marissa, get on the horn to the Anetti and just make him stipulate it was snowing? Then this case will be done by Wednesday next week.
Yep.
Jeepers effing creeps.
All right, I got to peace out. I got a meeting, so. Yay, bye guys.
We love you, Jamie. Goodbye.
Bye.
Baker.
Did we learn anything today? Yeah,
Well,
we learned that
we learned
everyone
that-
is.
We learned that Canton, Massachusetts, apparently everybody smacks their lips before they say anything.
Yeah. Yeah, there should be a snow machine at the compound so they can see it. But we learned that out of the 5 different people who was close to John O'Keefe, 2 of them had intimate conversations with Karen, not caught on camera. Hearing clearly, she stated, I hit him, even though they never talked to her. And they never mentioned that until they got to the grand jury after talking to Proctor. Then we have a guy stating, she said, he's effing dead, which we kind of could hear in the video. Then we have another guy saying, is he dead? And then we have this magical conversation in the middle of a blizzard with a woman who runs around like a headless chicken, stop him up and say, hey, by the way, I hit him. I hit him.
And all the cops.
Just we.
Nobody.
Yeah, the cops say, hey, Goody, come down here. It's in no police report. Just if anyone is wondering, thinking, that would be pretty much an important part just to write in a report that she admitted to hitting him with a car. We interviewed her, took down her statement where she said, yes, I hit him with a car. No, they said different stories was told at the scene. She was too hysterical to get anything useful out of. There's snow on the road in Canton town.
It's such a horrible sound, man.
And after you said, I was annoyed by it, but when you said it, you just hear it every smack.
Every single time. Well, there was this one time that at band camp, I learned how to play the flute, and
yeah.
Oh my God, y'all. This case is such a shit show. Lally really should be ashamed of himself for bringing this case. And if by the end of this, we don't actually figure out who had something to do with all these redactions and corrected
memories,
testimonies, memories. Yeah.
What are you going to hear? My brother's going to Bryan Adams tonight. I'm thinking that's a bad way to spend a Thursday night. But,
wouldn't be the way I'd choose to spend it.
No, me neither. The funny thing Bev did this morning was they can't narrate videos anymore, but Lally can still ask all the leading questions he wants if he just says, what if anything? But they can't point out and say, is this Jennifer McCabe? They have to say, do you see a person? Yes. Do you know who that person is? No.
It's amazing. The one guy, the Ricada's cousin, he was able to lay out a complete story of who was where until defense asked him who was where in the video. Then all of a sudden he had no clue. He knew exactly where he was in the ambulance. He knew who was on the stretcher. He knew who was doing chest compressions until the defense asked. And then all of a sudden he was like, I'm not sure. I can't recall.
It's really hard to remember when you get put on the spot and there's video evidence of what you said isn't true.
You would think that would make it easier, right? If I'm like, hey, there was this day that I did this thing and I can't really remember. And then Baker, you're like, well, here's the video that I have of you doing this thing on that day. Oh no, I can't remember any of that. I don't know. I don't know. Doesn't jog your memory.
Was I there? I don't know. It was first class CPR.
High class, high quality.
High quality.
That's what it was.
Yeah. Don't want that shoddy inner city CPR. You want the good CPR.
Not that George Floyd CPR. We want the good stuff. Oh God. I need to go probably pour boiling water in my ears so that I can stop hearing that smacking sound before tomorrow.
Yeah, and I need to not redirect to ended stream at Megan Fox today.
Ooh, I got to do that too. Where are we going, chat? Where are we going?
I think Megan is ended.
Content, this one, customization.
The one I have is covering the Karen Reed trial.
Which means they're all about to be done soon.
Yeah, I'm sending you all to recovery.
Wow, everybody is covering this case.
That's why we're sitting here and thinking, it's not doing those great numbers that we used to do, but then I go in and see Vices, Sean, everyone is covering it now.
Let's I'm gonna send my guys over to Viva He's doing something on Trump. Trump judge contemplates more terrible bill out of New York, Daily Wire drama, blah, blah, blah. We're going to Viva. He has no idea who I am, so that'll be fun.
Everyone, we'll be back tomorrow, 10 to 9, and finish up McLaughlin, and then we'll figure out how long the field trip is. We might take a trip, not a trip, take a break, put word crack on. We might shut off. We'll figure it out. The most important thing is Auntie Beb will make this horrible, the lip smacking will get worse, and Lally will ask the same question in 25 different ways without moving anywhere.
Guaranteed.
Yeah. Other than that, nothing else from me today. Anything from you?
I got nothing. Tomorrow, yo. Tomorrow.
What's 10 to 9, 11 hours? What? Just the cool kids are here. All the cool kids. Well, thank you all for showing up. Tell your friends we will be back here tomorrow. You won't get this annoyance of lip smacking on any other channels. That's what we do better than anyone else. Hasta la taco.
Later, y'all.
Your Honor, I apologize. What exhibit are you referring to? I'm going to make this 100, Your Honor. 100. Because it is 100% correct.
Objection, Your Honor.
You see the lawyer's face? Okay, we have to go back and
Widower case.
Did you, whether it's true or not, believe that Mr. Randolph had slept with your wife?
I wouldn't care.
You wouldn't have cared?
No.
Did you believe he had slept with your wife?
No.
Did you believe he slept with your mother-in-law?
Probably did. Everybody has.
Wait a minute, I need this story time.
Everybody has.
Everybody has.
Everyone has slept with his mother.
If I showed you.
Oh my God.
I'm having a Jamie moment. And the way he just said it, he was just like, everyone there. Things on YouTube.
Mr. Randolph, do you?
I gotta get some man. You don't know.
Called him chicken shit.
That's right, you are chicken shit.